क्या share कर रहे हैं? नाम काटर तो post डाइन है तंत
Assalamu alaikum warahmatullahi wabarakatuh. I welcome you all to this webinar. We are waiting for our guests to come and join. So we'll be waiting for a few more seconds. And as soon as they join, we'll be starting this webinar. Assalamu alaikum warahmatullahi wabarakatuh. I welcome you all. Sorry for the delay as our registrar sir is being connecting. So till then, we have sent you a mail for pre-test. You can fill the forms and submit it. And within 5 minutes, we will be starting our inaugural session, inshallah ta'ala. Please kindly check your email and submit the pre-test score. رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. Allah, whose bounties are unbounded, whose blessings are uncountable, most gracious, ubiquitous, praises to Allah and His Prophet, peace be upon him. I'm Mrs. Bushra Mushtaq, tutor, Alamdar Memorial College of Nursing and Medical Technology, organizing secretary of today's event. Assalamu alaikum warahmatullahi wabarakatuh, and special greetings to our dignities, guests, delegates, and participants. With great joy and immense exultation, it's an honor that this beautiful audience have joined our webinar. Welcome you all on behalf of Alamdar Nursing Faculty to the seminar on nursing research methodology. It's both an honor and privilege to stand before you today, and we warmly welcome you to this learned community. As we all know, how research is very important in any scientific purposes, and it's a very powerful tool today. Today we are getting here an opportunity to learn various things from various inputs from our eminent personalities. And I hope that this webinar will end with understanding the nursing research methodologies. Today, this international webinar will continue for 3 days, and today's event will comprise of 2 sessions, the inaugural session, which will be followed by the scientific session. Well, we need not to say about our chief guest, Professor Dr. Talat Ahmed, Vice Chancellor, Islamic University of Science and Technology and patron of today's event, but unfortunately, due to some official work, he is not present with us today. We feel honored to have with us the man who hardly needs any introduction, who made all proud with distinguished work, enormous capacities, the most inspiring personality, the transformation of vision into the reality, our guest of honor, Professor A.M. Shah, Dean Academics, Islamic University of Science and Technology, and co-patron of today's event. I'm profusely overwhelmed the man to introduce with selfless and sincere to our institute, expertise and knowledgeable, our another chief guest of honor, Professor Nasir Iqbal, Registrar, Islamic University of Science and Technology, the co-patron of today's event, who will be joining us quite momently. The esteemed honor for the personality who taught humble career as a humble teacher, who runs the nursing college of highest magnitude and dynamic leadership qualities. The passionate leader, our principal, our honor, Professor Dr. Mahmouda Rigu, Principal, Alamdar Memorial College of Nursing and Medical Technology and organizing chairperson of today's event. A desirable honor and respect for all who shaped and guided our students, dynamic and intuitive, my co-organizing secretary, Mr. Syed.shahid, Siraj. The persons with distinctive vision and the fountainheads of illuminating ideas, all the personalities with ideal knowledge and experiences and inspirations, the eminent speakers for today, all over from India and United States of America. I godly feel honored to welcome the enthusiastic and passionate faculty of Alamdar Memorial College of Nursing and Medical Technology, the faculty from all the other colleges from India and all the participants. I welcome you all. Research is a very essential part in the growth of any profession. Nursing research is a systematic inquiry about anything, about any problems encountered in our clinical practice, education, or administration. And the studies have great importance in the nursing nursing profession as well, because it provides a strong evidence and that helps us as a nurses to make sound clinical decisions and judgments. Today's webinar highlighting the different aspects of nursing research methodologies. Beginning this event, I request Mr. Syed.shahid Siraj, Organizing Secretary of today's event, for welcome address and overview of the program. Mr. Syed.shahid Siraj.
To start with the greatest name of Almighty Allah, most gracious and most merciful, whose bounties are unbounded, whose benevolence is everlasting, whose blessings are uncountable, whose being is eternal, whose mercy is unlimited, whose provisions are unending, whose love is our life, and whose worship is our faith. May I greet you all with the traditional Islamic greetings. Assalamu alaikum wa rahmatullahi wa barakatuh. Meaning, may peace and blessings be with you all. A warm good morning to all of you present here. A word about myself. My name is Syed.shahid Siraj, teaching faculty at Alamdar Memorial College of Nursing and Medical Technology, Islamic University of Science and Technology, Avantipora, Kashmir, and the organizing secretary of this webinar. It's a special privilege to have the honor of welcoming you all on behalf of Alamdar Memorial College of Nursing. The essence of great leadership is influence and not authority. With this note, I would like to welcome our honorable guest of honor and co-patron of this webinar, Professor A.M. Shah, Dean Academic Affairs, Islamic University of Science and Technology, Avantipora, Kashmir. Other than this, he is a top-notch avant grade, a recognized benefactor in the field of academics and research. We celebrate your leadership, sir, and you keep on influencing us. We welcome you, sir. We are really thankful to you for taking the time out of your busy schedule to join us. He who puts his heart and soul in uplifting others to attain dignity. With this note, I extend my warm welcome to our venerable guest of honor and co-patron of the event, who does not require an introduction as he is a well-known academician, a researcher, administrator, and a philanthropist. He is Professor Nasir Iqbal, Registrar, Islamic University of Science and Technology, Avantipora, Kashmir. We are grateful to you, sir, for accepting our invitation and becoming the guest of honor for today's event. I am proudly delighted to welcome our worthy organizing chairperson, Professor Dr. Mahmouda Rigu, Principal, Alamdar Memorial College of Nursing and Medical Technology. She is an inspirational figure in the field of nursing, a Florence Nightingale awardee. She has assumed so many roles in her journey of nursing. She is a notable academician, an administrator, a mentor, a researcher, and a state representative member of National Nursing Commission. She truly is an inspiration. We are truly honored by your presence, ma'am. Furthermore, it gives me immense pleasure to welcome our distinguished keynote speakers from different reputable organizations of India and United States of America. I feel immense pleasure to announce that our expert speakers are eminent and well-known figures of nursing fraternity. Their contributions to the nursing profession is immeasurable. Thank you for being here and for bringing your energy, ideas, and expertise. On behalf of Alamdar Memorial College of Nursing, I would like to take this opportunity to welcome all the dignitaries, delegates, colleagues, and students for joining with us today. Your ready response to our invitation is an indication that the aims and objectives of our college resonate with you. We are truly grateful to you for being us with today. We are here today so that all of us involved in research planning and development are benefited from the expertise of our distinguished speakers, who will be talking about the important steps and processes of nursing research. The primary aim of this webinar is to provide nursing professionals with insights to conduct relevant research that would contribute to the body of knowledge in their various areas of interest and to enhance skills for better teaching. We are committed to enabling new advances in the recent and future issues of research in different specialties of nursing. We want to share what new research opportunities are foreseeable on the horizon and what kind of methods have to be breached to get the best research outcomes. We are delighted to have you here, and I hope you will have a stimulating and productive webinar over the next 3 days. Now, according to the webinar overview, this webinar will last for 3 days. In consonance with the today's program schedule, we have already conducted a pre-test to assess the existing knowledge of participants regarding different aspects of nursing research. Since we have commenced the program by this inaugural session will also encompass the principal's address by Professor Dr. Mahmooda Rigu, Principal Alamdar Memorial College of Nursing and Medical Technology, guest of honor address by Professor Nasir Iqbal, Registrar, Islamic University of Science and Technology, guest of honor address by Professor A.M. Shah, Dean Academics, Islamic University of Science and Technology, and then the final vote of thanks by Mrs. Bushra Mushtaq, Tutor Alamdar Memorial College of Nursing, and co-organizing secretary of this webinar. This inaugural session will be followed by a scientific session in which 3 of our distinguished speakers will be sharing their expert knowledge with us on their assigned topics. Every speaker will be consulted by a specific chairperson to moderate the presentation. Tomorrow, the second day, will straight away start with the scientific session, whereby 4 of our keynote speakers will be sharing their proficiency with us on 4 different topics. The third day will start with the final scientific session, which will be having 4 topic presentations by our reputed speakers. The scientific session will be followed by a valedictory session, whereby a post-test will be conducted to determine the effectiveness of the webinar. It will also include the concluding welcome address, principal's address, and vote of thanks. We have quite fascinating topics on which our expert speakers will be shedding light, and I expect a variety of hot discussions throughout this webinar. I would like to close my speech by expressing my sincere wish for the success of all the participants to discover new opportunities in the growing area of nursing research. Thank you very much for your kind attention. Bushra ma'am, please.
Thank you, sir. Thank you so very much. The secret of the success is good leadership, definitely. To integrate team members and workers together. I request Professor Dr. Mahmooda Rigu, Principal Alamdar Memorial College of Nursing and Medical Technology, and organizing and chairperson for this event for principal's address. Ma'am, please.
Bismillahirrahmanirrahim. Honorable Vice Chancellor and Chief Patron, Chief Guest of the occasion, Professor Dr. Tallat Ahmad Sahab, could not be present on the occasion because of being in another meeting. And also, we feel sorry also for that, because it would have been colorful if he was there. I welcome esteemed Dean Academic Affairs, co-patron, and guest of honor of the occasion, Professor A.M. Shah Sahab, esteemed registrar, also could not join till now. Maybe he will be joining. He is trying again. He is trying hard to join. I welcome both of you. Syed.Shahid, Siraj, and Bushra ma'am, organizing secretaries, organizing committee and faculty of Alamdar Memorial College of Nursing and Medical Technology, my beloved students, speakers, participants of the webinar, and all HODs, guests of the inaugural session of this program. Assalamu alaikum to one and all. I am delighted to be among you all on the occasion of inaugural session of first international webinar on nursing research methodology, organized by our faculty faculty and students, because students are also taking directly or indirectly, they are also part of us. I once again welcome you all on behalf of our faculty, students, and on my personal behalf. The speakers, as Mr. Shahid said, speakers and resource personnel of the webinar are renowned faculty from universities of various states of India and abroad. The chairpersons of the scientific session and organizing committee members or the faculty of Alamdar Memorial College of Nursing and Medical Technology. The participants of this webinar, They are the motivated learners, like faculty, students, and scholars of various universities of this India and various renowned universities. Nursing research, you all are familiar with. We will be talking for 3 days what nursing research is, and most of you know as students, as learners, that it is a systematic study and assessment of nursing problem or phenomena, finding ways to improve nursing practice and patient care through creative studies, initiating and evaluating change, and taking action to make new knowledge useful in nursing. If we'll talk of the history of nursing research, it comprises of many changes and developments. The groundwork of what has flourished by late in 19th century and throughout 20th century, nursing leaders were struggling to bring it up through the various commissions, and it even continues even today, its progress, and it is they are innovating new things about nursing research. If we'll see key factors which influence nursing the research, they are the work of the Florence Nightingale. If we'll go to her notes, nursing notes, it starts from there, because she was environmentalist and statistician. And then because of that background, we have developed so many educational programs in nursing. Then development of nursing associations, all the nursing associations, particularly National Nursing Association of America, they are the key people who worked hard for nursing research. Then changing trends and developments in healthcare, especially the medical care and diagnostics, that compelled nurses to work for the nursing research. And then you will see the change in illness orientation. So we have emerging and re-emerging health problems, like we were in 80s, we were talking of HIV/AIDS. Now we are talking of COVID-19 pandemic. And we will see now it is unusually, COVID-19 pandemic has put all of us in trouble globally. And it needs a lot of research to find the preventive, curative, and rehabilitative measures, besides what is known at present to reduce the mortality and morbidity at the global level. If you'll see, since past few decades, nursing profession has experienced a profound cultural change throughout the globe, as nurses are increasingly expected to understand and conduct research to provide quality nursing care based on emerging evidence from research. That is, to adopt evidence-based practice. We will be talking a lot about evidence-based practice, and also you have heard so much about it. Even when we will talk of so many things were seen observed by nurses and which were practiced by doctors even. So they're like phototherapy. Nowadays we are practicing phototherapy because of nurses' observation. If that is evidence-based practice. Evidence-based practice is broadly defined as the best clinical evidence in making the patient care decisions, and such evidences typically come from research conducted by nurses and other healthcare professionals. The ultimate goal of research is to develop, refine, and expand a body of knowledge. Consumers of nursing research. Consumers or the nurses, whether educators or the practitioners, they read the research reports to develop new skills and to search for relevant findings that may affect their practice. At the end of the continuum, or the producers of the nursing research, the producers of the nursing research are the nurses who actively participate in designing, conducting, and implementing research studies. Previously, all research were only done by nursing faculty or PG students or PhD scholars. But now research is increasingly being conducted by practicing nurses, especially in tertiary care health institutions, who desire to find what works best for their patients. Between these two endpoints, the consumer and producer, this continuum lie a rich variety of research activities in which nurses may engage. These activities are, we are participating in a journal club, which I usually talk to my faculty. We have to participate in journal club, especially in practice setting, in nursing education setting. We are doing it because it will involve meetings among nurses to discuss and critique research articles which are pertaining to the care aspect, particularly solving clinical problems and making clinical decisions based on rigorous research, collaborating in the development of an idea for the clinical research projects, reviewing a proposed research plan with respect to its feasibility in a clinical setting and offering clinical expertise to improve the plan. Recruitment, potential study participants, who should be the participants of the studies, assisting in collecting of research information. That is, we can be part of big studies by distributing questionnaires to clients and explaining them what it is all about. Then giving clients information and advice about participation in studies, discussing the implication and relevance of research findings with the professionals and clients. The important need for nursing research is to develop a scientific knowledge base for nursing practice, which we need throughout. Then through a process of systematic scientific this inquiry, new facts and effective interventions are discovered by nursing research. Research not only helps in discovery of new knowledge, but also refines existing knowledge. The generated new knowledge can be used to improve what is most important, that's the patient care in clinical practice, community health nursing, nursing education, then nursing administration and nursing service. Nursing research generates information from which defines the unique role of nursing as a profession, because we need so many things to be a professional nurse. On the basis of evidence-based practice, provides accountability for nursing professionals, because we need to be accountable for our work. It strengthens the profession if we are accountable, if we are scientific, if we are independent as a nursing professional. Nursing research is an integral part of nursing profession for continual development of its body of knowledge. If you'll go to the American Nursing Association, as I talked for previously also, in 1981, they have identified various roles of nurses associated with nursing research projects in accordance with their educational level. These are, we can work as principal investigator, means we can conduct independent research. We can be this member of the research team at the national level, state level, and tertiary healthcare level. We can be we can work as an evaluator of the nursing research, producer of the nursing research, and at the end, consumer of the research findings. And we have a role as clients advocate. That is, during health studies, if others are performing the studies, we have to protect the individual rights of our subjects, our patients. That is it is not only ethical consideration of the subjects, it is our legal aspect in nursing, which we have been taught since the beginning, since first year of our nursing, BSc nursing. To strengthen nursing research, like other research, we need, as we cannot work without money, without manpower, without material, without methodology to adopt. Thus, there has to be defined financial allocation. My faculty, they are always talking of, madam, we don't have any financial allocation for research work. So there should be defined budget for the research work, as we are putting annual allocation for other areas. We need adequate student-teacher ratio. We need adequate nurse-patient ratio, so that we have ample time to take care of the nursing research. We need prescribed equipments and supplies for each nursing laboratory. We need high-tech laboratory system. We need good internet computers to develop the knowledge about latest technology to adopt. In short, if you'll see, we need what we are talking of, adequate infrastructure to work for development of nursing profession through standard nursing education and research to provide quality patient care. With these few words, I thank one and all to facilitate this webinar and make it a grand success. Thank you. Assalam.
Thank you, ma'am. Thank you so much for these wonderful words. Wisdom is sharing, support, and advice, dedication towards our work. I request our guest of honor, Professor A.M. Shah, Dean Academics, Islamic University of Science and Technology, for a few words. Professor A.M. Shah.
Bismillahir Rahmanir Rahim. Has Nasir Iqbal Saab joined? Hello?
No, sir, not yet.
Anyway, Principal of the college, Professor Mahmooda Ji, honorable guests, faculty members, esteemed participants. I feel honored that I have been invited for this webinar, which is actually organized by very special people, especially under the present circumstances. I am delighted to inform you that nursing college is one of the important colleges of our university. In fact, college has created a niche in the nursing education in the country. It is our core competence because students have to compete a tough competition. They have to face a turbulent competitive environment while entering the college, because for once we are getting thousands of applications for our limited number of seats in the college. So this college has created a niche in the area of nursing, and I believe, and rather I have been suggesting in different meetings that we need to support and we need to develop this college and this area of the nursing research in the university, so that we are in a position to promote excellence in the area of nursing research. I am, in fact, pleased that this webinar or this conference is organized on a very important theme, that is the nursing research methodology, which assumes great significance, especially under the present circumstances. If you see, for example, under this pandemic situation, a lot of experiments have been done, a lot of things have emerged, and a lot of, rather I should say, the new themes of research have emerged. How we are going to manage the patients, how we are going to manage the activities we have been carrying out, because different challenges, we have never seen such kind of atmosphere or such kinds of challenges or such kinds of activities which we have not performed earlier, and the people were supposed to do a number of things. So keeping this thing in view, this is a very important thing to understand what exactly we need to think about the research work which needs to be carried out. Obviously, from the university point of view, the focus of our university has been quality education and quality research work. Therefore, all our academic activities need to be directed towards achieving excellence in the activities being carried out by the university, by the colleges, by the departments, and by the faculty members at different levels. So research methodology in the area of nursing needs to be of high quality. And in order to go for the high quality research, as a student of management, I understand that there are some basic elements of research which we must understand. And those basic elements, for example, very simple terms is, for example, what is to be researched? The first question which we should ask, or the departments or the colleges at different levels should ask themselves is, what is to be researched? The question is identification of the areas of nursing to be researched. If we are basically able to identify the research areas, then we virtually half work is done. Then the second part of that is what research has already been carried out in this area. If we have identified that during the next plan, which somebody was talking about, that we should have a strategic plan for research, that these are the areas which are very important, very relevant under the present circumstances, very relevant for management, or very relevant for the college, very relevant for the university, and very relevant for the public. So these are to be identified. Then the second part is that what research has been already carried out in the area. And if we are able to understand these two things, then we will be able to do the research very effectively, and we'll be able to do a quality research. Basic point in the research. Second part which we must understand is why it is to be researched. The question is, which we should ask, why we are going to research it. What is the purpose of this? What is the basic strategic intent of this? So why we are doing it? Because if we believe that we are doing this research because we want to manage this activity in a better manner, we believe this activity is being carried out, but this is not giving us the desired results, or this is not giving us this kind of the activity is being carried out and it has got this kind of implications. And the question is, if we are able to identify the purpose, then we will be able to focus on that purpose. And the third thing is how is to be research, means research methodology, where we start. But this research methodology should start from day one. So it may start here, how it will be researched or how it is to be carried out. But before research methodology comes, what is to be researched? Because otherwise, if we are researching that topic which is not needed, it means that this exercise will be an exercise in future. So then how it is to be researched means thereby, in case of research, whenever we are talking about any kind of research methodology, obviously those people who are going to carry out a research or who are carrying out the research must try to focus on the quality parameters and data collection regarding the parameters, what would be our universe, what would be our sample, how we are going to directly or indirectly get involved in this. So if we are able to identify the parameters, identify the areas, then we will be able to set our research methodology in a correct manner. Obviously, I have seen in the research in the social sciences, research in the sciences, research in the medical sciences, almost the basic parameters are the same. Wherein, for example, you identify the area, this area needs the research, then you try to, you try to identify the research questions. And then when you are able to identify the research questions, and those research questions emerge when you review of literature. So in the review of literature, you understand these are actually the areas which have been already researched. But after thoroughly reading those, research papers or research projects what have been carried out, you see that these are the areas, these are the missing links. These are the areas which have already been done, but these areas need to be done in this way or in a better manner. So then you identify the research questions, and once you are able to identify those research questions, those research questions help you to go for the proper research. So understanding different aspects of the nursing research. So I believe this seminar, I have seen that there are many technical sessions after this inaugural function is over, and I have been given to understand that learned speakers from different colleges of the different institutions of the country are participating, delivering lectures to our students. I believe they will be able to make our people understand the different aspects of nursing research, and that will help us to promote excellence in our research activities, I am sure. And then the last one is that whenever, for example, any research activity is carried out, most of the things I have seen, these research were carried out in the universities, in the colleges, in the educational institutions, in the hospitals, in the medical college. They remain confined to the libraries. So dissemination of the research is a very, very important thing, wherein some kind of mechanism needs to be developed, wherein whatever research has been carried out, this is to be communicated to the decision makers who are involved in the nursing education, who are involved in the nursing management, who are involved in the nursing policy making, who are involved in the government in this area, so that the results which the homework which has been done by the college or by a student or by a researcher, then becomes actually they are put in practice. Actually, those things are done in a nice manner. So this is also very important. So some mechanism needs to be developed there. The principal of the college has, in fact, talked about different activities or different things what the university or the college should do, so that the college is developed further. Its infrastructure is strengthened. Similarly, they are able to carry out the quality research work. So I would suggest the college principal as well as the faculty members of the nursing colleges, both the colleges, that they should prepare a strategic plan for this college. normally what we are doing in the day-to-day practices, we get involved exclusively in our present practices and try to manage those present practices. That is then that is required. I don't say that is not required. That is to be done, definitely. But at the same time, a college or the head of the institution, in consultation with the faculty members, should prepare a strategic plan for the college, that this plan is for next 5 years, this plan is for the next 10 years, this plan is for the next 2 years. Means thereby these plans could be for the, then that plan could be split in the short run, what activities ought to be done in the short run and what activities ought to be done in the long run. For example, certain things were always in the pipeline where we were thinking in terms of enhancing the seats, we are thinking in terms of going for the PG program, and certain proposals have been sent to us. But I assure you, once you come up with a strategic plan, this plan will be obviously placed before the highest body of the University Executive Council. And once the Executive Council gives approval to that plan, that strategic plan, this should be thoroughly discussed. And once that is done, means thereby it may contain different things. Number one, what activities we want to carry out for the next 5 years. Number one, and what infrastructural facilities need to be developed for carrying out those activities. So it will have the one part, and then the third part would be what funding is required. So first part of that strategic plan, as a student of management, I'm telling you, would be these are the things we want for the next 5 years, so that we are able to develop this college further, so that we are going to achieve excellence in the academics as well as in the research. Number two, part of that should be that these are, in order to carry out or in order to do these activities, we need these kind of facilities. So infrastructural facilities need to be carried out. This may contain, say, some physical buildings, this may contain equipment, this may contain labs, whatever is required to be done, this is also be identified. And then the last one in that should be what exactly is the funding required for. A tentative budget should be prescribed there. So we may need, for example, and it may contain in the budget, it may in the infrastructure facilities, it may call for both things. Number one would be, and that would be for these are the physical facilities to be created. But similarly, another thing would be there, we need these human resources. Human resources would be the faculty, we need the technical staff, we need the supporting staff. So this should be a plan like that. And then what exactly is the financial support we want from you? And this financial support could also be that support wherein you believe that this amount is basically an amount which is basically a fixed, we call in economics that a fixed cost, means which will be done once. But then there would be certain elements which are the running costs or maintenance costs, or we call the non-plan side of the thing, wherein you require the money annually to do those activities. So if you prepare a strategic plan, I think I have been advising, because we were doing it in the institutions in the University of Kashmir. So once you are able to do it and this plan is approved, then you have a roadmap, that this is the roadmap for the college. I have seen, for example, certain people coming up with a proposal, for example, regarding the seminar. We want to conduct a seminar. So nobody will stop you from conducting these people, but provided when the budget meeting of the institution is held, and you are projecting the important activities and accordingly get a budget for that. To justify that these are important activities to be carried out for carrying out the education as well as the research work for the institution. So if inshallah this plan is prepared, if inshallah these activities are identified, so whatever university is required to be done at my level, I'm going to tell you that whatever support you want from our side, that we will be there to support you. And not only that, you must think, because that will make you self-sufficient, that the college ultimately should develop in such a manner, because it becomes an autonomous institution. Autonomous, I don't say autonomous in the sense, autonomous so far as it is not dependent upon the people. I have seen a lot of people, for example, crying for faculty, a lot of people crying for infrastructure, a lot of people crying for one facility or other facility. Maybe, obviously, universities are also having the limited financial resources available, but within those limitations, I assure you, what are the important activities to be carried out? And those activities can be, inshallah, supported by the university. Not only that, I have seen there are many institutions, there are many funding agencies wherein faculty and the institution can apply and they will fund your activities. And especially, under the present circumstances, the health sector has assumed great significance. And under the present circumstances, it is now the responsibility of the college administration, responsibility of the faculty to identify what is to be required to be done after, say, what challenges are emerging, and for meeting those challenges, what facilities we have to develop, what are required within 1 year, within 2 years. You see, a lot of countries and a lot of people and a lot of have suffered. Why? Because they were not prepared for that. So they could not prepare in advance. So this is what exactly we call planning, or we call strategic planning. So strategic planning work should be carried out, and that could be, inshallah, the base for that. Even I assure you, if you want my help in that, for preparation of that, it will be my pleasure to be with you in your college and to help you in preparing that. And then we may put, because, for example, if you are not putting any proposal, and if you are not putting any proposal, you can't expect, because I have seen some institutions coming, the work used to be done, or there's some activities to be done, say after 10 days, coming a proposal with before 10 days. So obviously in a university system, there is a mechanism. These are to be examined, then these are to be approved by different the authorities, or approved by different bodies. So it cannot be done at the individual level. There are apex level bodies in the university system, and for that you have to submit the proposals. And I am sure, inshallah, our nursing colleges, our people are very competent. I know they have been putting a great deal of effort to make this, the nursing education excellent way of, helping the people, excellent way of helping our students, and whatever is required to be done at the university level, inshallah, we will be there to support this. So with these words, I once again, congratulate the principal, the faculty, and other people, organizing members of the committees, that they have, in fact, organized this webinar. And I believe this will be a great activity, and it will help us to promote excellence in all our activities and all our, the educational aspects in the nursing education and the nursing research activities. Thank you very much.
Thank you, sir. Thanks so very much for the nice words. You are our guests, and generally the hosts do feed our guests. Here I am privileged to present the vote of thanks for today. Firstly, on behalf of entire faculty of Alamdar Memorial College of Nursing and Medical Technology, my sincere thanks and gratitude to our guest of honors, Professor A.M. Shah, Dean Academics, Islamic University of Science and Technology, and Professor Nasir Iqbal, Registrar, Islamic University of Science and Technology, who gave the permission to conduct the 3-day webinar and provided their immense support through our every step in progress. I would like to express our high gratitude to Professor Dr. Mahmoud Arrigu, Principal Alamdar Memorial College of Nursing and Medical Technology, and organizing chairperson of the event, for the entire webinar, for logistic support, encouragement, and guidance throughout. I'd like to acknowledge the sincere thanks to respected speakers with the aim of enriching the professional community with their knowledge and skills. I'd like to present heartfelt thanks to my second organizer, Mr. Syed.shahid Siraj, for the friendly support, the valuable suggestions for making the event successful. I'd like to take this opportunity to place on record our hearty thanks to entire faculty of Alamdar Memorial College of Nursing and Medical Technology for enormous cooperation in the organization of this event. I'd like to extend my deep, warm, heartfelt gratitude to all the faculty of different nursing colleges, the participants, and the students for finding the event informative and joining for the educative purpose. I once again am grateful to all. We thank you all for being with us in this event. It's been a great pleasure to have you with us. Now we are to begin our scientific session with the pretest as already is being circulated through your email ID. If anyone has not filled the form, kindly do that so that we can find the already existing knowledge. Nursing research assists us to elevate the standards of any profession. In addition to the knowledge contribution will be increased in any discipline rather. The interest of the researcher is very much important for conducting any sort of research and in selecting his or her research problems. So let's begin the session by our first resource person, Dr. I. Clement, Professor and HOD R&D, RV College of Nursing, Bangalore, India, with the topic identification of the research problem and formulation of research objectives. And Mr. Syed.shahid Siraj, Tutor Alamdar Memorial College of Nursing and Medical Technology, will act as a chairperson. And any questions from any participants, they will be posing the questions to the respective chairpersons so that it could be discussed with our resource person. Dr. I. Clement.
Good morning, ladies and gentlemen. Since you have already heard me in the welcome address, now I will be moderating the first presentation of our scientific session, which is about identification of research problem and formulation of research objectives. And today we are going to learn how to identify an appropriate research problem and how to formulate research objectives. We are constantly asking to better understand ourselves and world around us. This human ability to wonder and ask creative questions about behaviors, experiences, and situations in the world provides a basis for identifying research topics and problems. Identifying a research problem is the initial step and one of the most significant steps in conducting qualitative, quantitative, and interventional research. The research purpose evolves from the research problem and directs the subsequent steps of the research process. To gain the better comprehension of the topic, I am so pleased to have the opportunity to introduce our first guest speaker, Professor Dr. I. Clement. He is a professor and head of the Department of Research and Development, RV College of Nursing, Bangalore. He has numerous golden feathers in his cap of professional achievements. He is a recognized PhD guide and PhD examiner of Indian Nursing Council, Rajiv Gandhi University of Health Sciences, Bangalore, and several other universities of India. He is the chief editor of PhD Nursing Society of India and several other nursing research journals, for which he has secured his position of being executive member of Indian Authors Association. He is the author of 80 nursing textbooks and has more than 70 national and international publications. Yes, you heard me right, 80 nursing textbooks and 70 research publications, and I think that's huge. He has been awarded by Florence Nightingale Award, Education Excellence Award, and National Mahila Ratan Gold Medal Award. It will be onerous to enumerate the achievements of Professor Dr. I. Clement in this short span of time. We are all fortunate enough to have this opportunity to learn from you, sir. Without further ado, I would like to invite Professor Dr. I. Clement to share his words of wisdom with us. Please, sir.
Can you hear me, sir?
Yes, sir, you are audible.
Yes, 1 second. Thank you, Syed. Thank you so much for your introduction. So I'm happy to be the part of resource person in this webinar. So first of all, I thank the Islamic University of Science and Technology, and also Al-Badar Memorial College of Nursing, Kashmir, for organizing an international webinar on nursing research. So I know how much painful for organizing a research and how much hard work needs to be done. And the College of Nursing faculty, they all joined together and organized this webinar. And I take opportunity to thank the Vice Chancellor of Islamic University of Science and Technology, Professor Dr. Talat Ahmad. And next, I take opportunity to thank the Registrar Nasir Iqbal, the Dean of Academics, Dr. M.A. Shah. Sir has very briefly and very important things of communication and utilization of research has given a highlight. And also the Principal, Dr. Megamuda Regu, and also the Organizing Secretary of Mr. Syed.Shahid, and also Mrs. Bashira, and also the entire team of the organizers, the staff members, students, participants. So I take opportunity to thank one and all. So coming to the research. So in a research, Principal Ma'am and Dr. Shah has given very detailed and very elaborative why the research is needed. Because research is the body of knowledge which is essential for any profession, not only nursing, any profession, the body of knowledge of research, which takes a very vital part for the development and the growth and the establishment and all those things, etc. So I'll just come to the topic here. Introduction of research problems and formulation of research objectives. So research, as the word mentions, like research. Re means again, search means searching for the new knowledge or new fact or new information again and again. It may be a very small, especially now this COVID pandemic situation scenario has given the very huge platform for organizing a variety of researches. And the research question is very important, which is the basic blueprint of the building, and which is making it should be like properly selected, and it should be the proper strong pillars are very essential for selecting this research question or research problem. So we are going to briefly discuss about the components, characteristics, functions, and steps to formulate, and some of the examples we are going to discuss in brief. Coming to the introduction part. So research problem is a question that researcher wants to ask or a problem that researcher wants to solve. So the researcher it may be a part of curriculum or it may be a part of professional researchers. So there the researcher selects the problem, appropriate problem, needy problem, and the very important issues needs to be solved. So based on that, the researcher selects the problem. That is very important. It is the first step of research. So we need to, the critical thinking and analysis needs to be incorporated, and the right problem needs to be selected. The research problem is an issue, concerns that an investigator or researcher presents and justify the research study. Is going to travel or is going to journey with the big problem that from the introduction to the communication and utilization of that particular research. So he will be traveling the entire, that particular problem, he travel with that. So identification and formulation of research problem is the first step of research. And it also the most challenging and difficult phase in the research. So it is really a challenge for especially like the person the PG students, they will be confused what topic needs to be taken, how the steps needs to be there, how scientifically it can be processed. So all this type of confusion and challenges which is happening in the beginners, and once if it is understanding and the concepts are clear to the person, and he will be enjoying the steps. So as I mentioned the previous slide, this is the first step. Identifying the research problem is the first step in research process. Then it comes review of literature and research purposes, data collection, analysis and interpretations, and evaluation of research and report. So these are the other steps which is followed with the identifying research problem. So here the research problem, it is based on the idea. It may be, for example, the COVID complication, or maybe the psychological well-being during the COVID and COVID pandemic and elderly. And after now, the third wave is expected for the children, like it is coming in everywhere. So researches are conducted. There are so much, the ocean of informations are there. So first we need to come with the idea, and from that we need to go for brainstorming. Means we need to gather from various experts and various people who all are actively involved. So first we need to concrete idea needs to be set, and followed with that brainstorming is essential to gather or to formulate to come to the conclusion of some sort of research problem. And also the researcher needs to do a in-depth review of literature review, which is most essential, which is the backbone of this research process, because the previous researchers done, it may be globally any part of the world, the researchers are done on particular study, and that needs to be collected. There now the technology or the media and also that internet facilities are available to collect all type of related review of literatures, and based on that we need to do a background work. So what is that topic, and what type of methodology they have used, and what type of statistics they have done, and whether this is appropriate or applicable, whether it is reliable or it's already valid, and all those things needs to be confirmed with the previous research work done by literature review. And also identifying the variable, which is very important, like you need to select the very important variable, independent and dependent variable. So which is that because of the two variables where the entire study is going to travel. So make sure that identifying the right independent variable and dependent variable, and based on that, especially this is in a qualitative or quantitative research. We have the research is broadly classified into qualitative research and quantitative research, and here in the quantitative research, the variables are very essential, because the effectiveness is measured with the help of this dependent variables and independent variables, and formulate the research problem and question of hypothesis. And also the selection of research problem depends upon the various factors, such as researcher's knowledge, the skill of the researcher, the interest of the researcher, the expertise in that particular field. For example, the person is working in a critical care unit. He wants to learn about the the oxygen saturation and oxygen status of the person. And also the other factor is like motivation of the researcher and the creativity and novelty with the respect to the subject chosen. So here the creativity and novelty takes a major role in selecting the problem. Novelty is nothing but we are just want to find something, going to get something new or different from other routine things. So there will be a change, or there will be a entirely there's a new approach used in novelty application, and also creativity takes a very vital role in selecting this research problem. So these are the several factors of knowledge, skills, interest, expertise, motivation, creativity, and novelty takes place in the selecting for the research problem. And also good research studies needs a lot of time for selection research problem, because time needs to be taken to select the appropriate topic, needy topic, important topic, which is used for the society and used for the nation, or the existing problem needs to be studied, and so that it needs a lot of time for selecting the topic. Next is the initially every researcher faces the predicament of identity, selecting and formulating the good research problems. So here the next slides, how to select a research topic. There are different factors we have discussed here in selecting the research topic. So it starts with the known to all the requirements and relevant to your field of study, whatever it may be, a pediatrics or psychiatric or medical surgical or mental health, and whatever your field, it may be infection control, or it may be a nursing education, or it may be a nursing research in, it may be a nursing practice. So relevant to your field, and you need to relevant, that should be like there should be a need should be there, and there should be a significance should be there, and all those things, the relevancy needs to be checked before you select your problem, and also align with the current trends and the hot topics. The next, the selection of research topic is based on the aim to solve the genuine contextual problems. For example, now the COVID-19 scenario or pandemic situation, there are a lot of questions which is asking to us, why it happening, what it will be happening, where it will be happening. So it is nothing but all these questions needs to be answered in a terms of research, and that proper selection of topic. We cannot do a research on too many topics. We need to stick with one particular topic, and we need to conduct a in-depth scientific process application or study needs to be conducted. And the next one is, it should be a researchable topic. We should not be just like wavering topics, we cannot be taken for as a research. And we need to, the research topic should be a researchable topic, whether it can be done further, or in-depth study can be, or scientific application can be applied. So those topics needs to be given concern, and the topics needs to be selected accordingly. And keep page or word limit in mind. And also it should be a spark your interest. Without interest, just for the namesake, when we are doing in a completion of our master degree or any academic degrees, without interest, there is the research will not be a meaningful one. So the researcher interest takes a vital role in selecting the problem, and also the research problem should be relevant to the supervisor's field of study. The other area, the research problem should not cause issues in the data collection, and check the availability of data collection tools and before choosing the topic. So the researcher should be very clear and should have that topic selection should come on the motivation and interest and the availability and the existing problem. All those things needs to be taken consideration, and based on that, the researcher needs to select the topic, and from that topic he will be proceeding or traveling. Coming to the next steps in identifying a research problem. There are 5 steps, very important basic steps are given here. Means the outline the area and the choice of topic, narrow your topic. 4th step is identify a research problem, and the 5th one is identify the purpose for your study. So here the researcher must be observe your environment, and the researcher must be very curious and should ask questions to them, to yourself, why you have taken the problem and how you are going to solve, and what type of support or literature review you have, and all those things needs to be taken into the consideration before the research problem is chosen. Next, we are coming to the components of research problems. The components are very important and essential role which is taken place in topic selection. It is based on the relevance of the study, title of the study, and operational definitions of the variable, which is very important, like what the dependent variable role and what the independent variable role, and that needs to be very that also related to your particular study, and that needs to be explained in a very brief, and objectives of the study and delimitations, limitations of the study and scope. All those things needs to be taken into consideration as a component of research problem. The formulation. Excuse me, it's got stuck 1 second. Yeah, next, these are the component. Next slide. The formulation of research problem steps are: the first one is identify a broad field of subject area of interest. So, for example, the student, the first year post-graduation MSc nursing students, he wants to do a research as per the requirements of the curriculum. So you will be just going to the surgical department or the unit, and you just saw that like patients has undergone surgery, abdominal surgery, and lying there for more than 2-3 days till the word of the doctor says like the patient can be ambulated, you can slowly walk, started walking. Like that instructions are, it comes from the mouth of the surgeon. The patient is keep lying in the bed. So here the nurse is taking an initiation. Sir, shall I ambulate the patient, or shall I move the patient? So that which will be helping to improve the respiratory function, gastrointestinal function, and also the renal function can be improved, and also the circulations will be improved, and there will be a minimum of minimizing the complications like DVT. And all those things, like the nurse can take an initiation to start with the early ambulation, means with the concern of the particular surgeon. So the nurse can start at moving or providing a early ambulation. This is a simple example I just want to tell it to you all. So starting with a simple intervention, and make the patient to sit and make the patient to stand. And also we need to consider that the patient is conscious and the vital signs are supporting the normal vital signs, and the gradual movement of 1 or 2, 3 steps and back the patient to the bed. If the patient is having the psychologically, if the patient is not strong and cannot cope up, we can put back the patient to the bed. So this all these things like which helping for the early ambulation, and which will be definitely helping, or which will be providing a post-operative recovery earlier, and also prevention of complications. So this is a simple example I just want to share. Like before when the researcher enters into the field or into the surgical area, and when he identifies a patient is lying after surgery for many days, and there may be an initiation taken to ambulate. And second step is, it is discrete the broad area into the sub areas. So once the surgical area is chosen, and the next step is whether he is going to deal with the abdominal surgery, or the patients having other surgery, other orthopedic surgeries, or any cardiac surgeries. So you need to select from the broad topic of surgery into that. He needs to be particular with that it is going to be abdominal surgery. So abdominal surgery is the area which he is going to give a consent, and also select and what is the most interest in you. So whether you want to learn about the movements of the patients, or mobility, or making the patients to walk, or meeting this activities of daily living. So what exactly you want? So select what is the most interest on you, that should be your that should be given concern for the your topic selection. And the fourth one is perform preliminary literature review, whether the previous studies or researches are done on that particular topic on early ambulation. So we will go and check in various digital platforms, and also the libraries. The huge libraries are available in various places like Niman, CMC, Vellore, and other places. So we can go for the previous related research studies are done. The thesis can be viewed, or if it is uploaded in the internet, we can check it. We can get, we can request for the complete study to read and study about, to collect all the informations for your selection of your topic. And also come up with the general problem statement. So you can come up with the effectiveness of your modified early ambulation, or early ambulation, and post-operative recovery, or prevention of complications. So you need to be come up with the general problem statement, and raise the research question. What exactly you need, how, what you are going to measure it, and with what type of tool you are going to take it, and that mindset needs to be set before you select the topic. And also identify the aims of the study and how it is. Next slide. Madam, can you move the next slide? Next, coming to the characteristics of good research question. So remember, the good research question, we need to remember finger criteria. That is nothing but feasible, interesting, novelty, and ethical relevance. So coming to the feasible, whether the appropriate number of subjects will be available, whether the adequate technical expertise can available in that area, and also affordable time and money, the possibility needs to be checked, and also measurable in scope. These are the things needs to be feasibility, the investigator needs to check. Coming to the second one, interesting. It should be the interest of the investigator plays a vital role, so which is most important. So that the interest is the motivation which push the investigator or the researcher till the end, and which provides energy for conducting the or completing the research study successfully. Third one is novelty or novel. It confines or refuses the previous findings, and also it extends the previous finding, and it provides a new finding. So novelty is nothing but it is a change or new fact or new informations which the researcher wants to provide to the society or profession. The fourth one is ethical relevance. So whatever the research or conducted, that should provide a scientific knowledge, and also to the clinical and health policies which will be supporting, and also to future research directions needs to be given, and that needs to be taken into consideration. And next slide, we are seeing that identification of research problems. So here the identification of research problem, as I mentioned earlier, it is the first step of a research process. It is generally a broad area selected, and then it is delimited for narrow down to the specific one sentence statement of problem. Here the first one is identify the broad field or subject area to interested to you. Next one. In this first step, that is formulation of research problem. The first one, the steps are needs to be considered. Identify the broad field or subject area of interest. Dissect the broad area into sub areas. Select what is of most interested. Raise research questions and formulate objectives. Assess the objectives and double check in the first step. Second one, next slide. Second one is reviewing the literature we have discussed already. So it is an essential primary task in order to acquaint yourself with the available body of knowledge in the area of interest. The literature review is an integral part of the entire research process and makes valuable contribution to every operational step. So here, the review literature can be a time consuming and also it will be a frustrating but not rewarding. The functions of this review of literatures are, it brings clarity and focus to your research problem, and also it improves the methodology, means what type of the research design needs to be selected, population, sample size, so etc., which helps for a research methodology which supports, and also which is burden, which will be facilitating the knowledge, and which also will be supporting for the complete shape of or mindset which will be providing for the researcher from the review of literature. Next slide. So the procedures are relevant to the review of literatures are, means searching for the existing literature in your area of study, and also the researcher needs to be the review the literature selected, and he needs to gather all the review of literatures, and then needs to be start studying and understanding the components and various approaches are used in that particular review of literature, and also from that the researcher will be developing a theoretical framework and also developing a conceptual framework from that. Next slide. Next slide. And the record importance information in relevance to the separate indexed card which contains the keywords and also the summary of the contents of the books, articles which is relevant to your study, means the research material can be collected from any sources. We are going to discuss about various sources like electronic media, and again in electronic media, and it is from Medline or Sinol, or there are different websites are available here for searching for the nursing related, that also current related research studies can be collected and gathered, and also brief analysis of content, the comments such as like how the information from that particular study could be used in your research, and also information obtained from the key persons could also be summarized on the index card review of literature. Next slide. The third step in this selection of research topic, that is the formulation of objectives, which is very important. The objectives should be like general objectives, and specific objectives needs to be formulated before the topic is selected. The objectives are the goals you set how to attain the your study, and also this research objectives, they inform the reader what you want to attain through the research study, and also it is extremely important to word them clearly and specifically. The objectives should be listed under the two headings, that is main objectives and sub objectives. that is general objectives and the selected or important objectives. The main objectives in an overall statements of the trust of your study. It also the statement of the main association and relationship that you seek the discover or establish, and also the sub-objectives or the specific aspects of the topic that you want to investigate within the main framework of your study. And also this objectives, they should be numerically listed, and also the wording should be clearly, completely and specifically mentioned. Next slide. The researcher study the importance that the components are used should be operationalized in a measurable terms, so that the extent of variations in respondents and understanding is reduced, if not eliminated. And also it is very important that techniques about how to operationalize concepts and knowledge about the variables and play an important role in reducing this variability, and also the knowledge. So therefore it is important in fine tuning of your research problem. Next. And the variables are very important. The researchers needs to be given means the importance needs to be given for selecting the independent variable and the dependent variable, and also the affects the changes in the dependent variable. For example, the manipulation done in the independent variable. For example, as I mentioned earlier, the modified yearly ambulation procedure, which will be changing in the dependent variable, such as post-operative recovery or activities of aid, improvement in the activities of daily living or functional activity or psychological well-being, which will be providing a changes in the dependent variables. So it is very important that the proper or the appropriate selection of dependent and independent variable are most important when we are formulating the research problem. Next. And we need to give about the hypothesis. Hypothesis are needs to be tested. And hypothesis is an assumption, suspicion, and ascertain of an idea about the phenomenon, and also relationship or situation, the reality or the truth of which you would like. And also the researcher calls for this assumption, hypothesis, and they become the basis for the inquiry. And also the hypothesis is in most of the studies, the hypothesis will be based upon your own or someone else's observations. The hypothesis brings clarity, specificity, and also which will be helps for the focus to the research problem, but are not essential for the study. And also you can conduct the valid investigations without constructing the formal hypothesis. Next one. The hypothesis will be classified into 4 types. One is hypothesis of difference, hypothesis of associations we need to check, and also the null hypothesis, there won't be any significant relations between the 2 variables. And also there will be the 4th type is alternative hypothesis, which will be discussed later. Next slide. The sources of research problem, which is most important. The researchers needs to get the information from the various sources, like personal experiences. The second one is practical experiences based on where the researcher is working. And third one is critical appraisal of the literature. The 4th one is previous research studies conducted by various universities. And the 5th one is existing theories. The researchers can get an idea of preparing or formulating the statement, means the problem. And also from the existing social issues are the sources of taking this problem. And also brainstorming from the various experts can contribute, and the topics can be selected from brainstorming, and the intuition of the researcher is also the another source of selecting the problem. And ninth one is exposure of the field situation, and last one is consultation with the expert. These are the very important source we are going to see very briefly in one by one. Next slide. Next slide.
Please bear with me. There is some problem with the movement of slides.
Okay, sir.
Okay.
Yes. So here the sources of research problem, as we discussed, these are the very important areas. Clinical experience.
हाँ मैडम आपने ज्वाइन नहीं किया अभी हाँ ज्वाइन नहीं किया
And also nursing literature, social issues or problem, and nursing profession priorities, and also nursing theories, intuition, and peer consultations are the very important and essential source for our nursing profession. Next slide, sir. So can you move to the next slide? Sir, I can move from my side. Coming to the personal expertise. So here day to day experience of the researcher serves as a good source of idea to formulate the research problems. So here the personal experiences are, for example, the researcher observed the domestic violence suffered by wives of alcoholic husbands. This is a very simple example, like personal experience which contribute for the selecting of a research problem. And this experience may provide idea to identify several research problems related to domestic violence against women. So like this, we can compare into our clinical area. There are so many problems like COVID related problems in present scenario. We can select small problems based on personal experience we come across, especially like the side effects of the vaccination, COVID vaccination or Covishield. So this small informations can be studied in detail by which will be contributing to the personal experience of selecting the problem. And also next one is practical experiences. The nurses are working in the hospital setup and also in the community and other various areas, infection control, and especially like a COVID areas, situations, they are working in a critical care units. So based upon their clinical expertise, which provides nurses ample of opportunities for problem identifications. And this also serves as a source for identifying the research problems, especially the clinical experience provide nurses ample of opportunities for the problem identification. And this serves as a sources of identifying the research problems. The personal experience. Coming to the third sources is critical appraisal of literature. So when the researcher looks into the books, articles, summarizes of clinical issues relating to the subject of our interest, pertinent questions may raise, and this may sticks the reader's mind by stimulating the imagination and directly and adding the research need. So this is the research based on the critical appraisal will helps how to do it by following the steps are the research questions, literature search, and also select the titles relevant to your study and also read the abstract and to get the rough idea about the study setting, methodology and findings. So here again, the critical appraisal, which also will be collected or the information from the introduction of the previous research study, methodology. In methodology, like type of population, setting and study design and data collections, all these informations can be collected by the results of the research work, previous research work. The analysis and confounding factors can be collected, studied, and in a discussion, it compares and contrasts the finding and supported by the literatures, and also the we can now get information from the references, whether it is a reliable references or any potential articles to be snowballed off. So all these things will be from the critical appraisal. We can collect the informations, and also to formulate our own research topic or research statement of problem, we can make a source of previous researches. The previous researches or the body of knowledge is developed on a sound research findings or using a scientific steps. So it is usually at the end of the research problems are suggested based on the shortcoming of the previous research and could be investigated. The previous researches are example, in a small scale descriptive study, the researcher find that the number of patients admitted in the coronary artery disease had an increased body mass index. The another research studies says that the researcher may use this finding to formulate the hypothesis on obese patients have a increased risk for development of coronary artery disease. And next one is the next resource is existing theories. So existing theories are the providing a platform or providing a information to select the problem or to refine the problem to make the best problem for the research. The research is the process of theory development and theory testing. So here the theories also, like any new theories are invented before application, it needs to come for the research needs to be done. That is in a theory building and the theory testing needs to be done. In an existing theory is used in developing a researchable problem. A specific statement from the theory must be isolated. Generally, a part or parts of the theory are subjected to testing in a clinical situation. The testing of theory is needed before they serve as a good source of research problem. The existing theories. The research is the process of theory developing the theory and research. So here, nurses uses a many theory from the other discipline. Example, like we are using a system theory, input, throughput, and output process from the management discipline, and also other the theories are borrowed from the psychology and sociology and education, other aspects. The theories are borrowed, but now we have in present scenario we have our own nursing theories, the body of knowledge which developed by the nursing scientist. And in an existing theory is used in applying a research problem. A specific treatment for the theory must be isolated. There are other source is the social or burning issues or plays a vital role, especially the present condition scenario of COVID-19 pandemic, which is providing a platform, huge platform. It's a ocean of researchers are in it. So here, this social issues, sometimes uses of the global, contemporary or political issues of relevances are suggested. An idea for research may be stem from the familiarity with the social concerns or controversial social issues. And the next very important source for selecting the research problem is that brainstorming. Brainstorming session are good technique to find the new research questions. The brainstorming refers to the intensified discussion among the interested people of the profession in order to find more ideas to formulate the good research problems. That's why before we select or before we before we get into the research topic, we will need to discuss with some sort of experts, especially like the guides will be helping you to formulate. They will be identifying what type of interest the researcher is having it, and what topic, if it is taken by you, that will be successfully or gratefully it will be completed. That suggestions needs to be taken from the experts by brainstorming method. And the golden rules for brainstormings are for a quality and accepting everything, and it defer the judgment, and it allows the unconventional ideas, and this brainstorming builds on each other's idea, and also list every idea in the brainstorming session, and every person and every idea has equal worth in brainstorming session. And coming to the next resource sources is intuition. So intuition is nothing but there's a idea which the researcher gets. The intuitions are considered a good source of knowledge as well as the source to find a new research problems. And it is believed that the reflective mind in a good resource ideas which may be used to find out the new or good research problems. The dimension of intuitions are, it is biological, phenomenological, and all these areas means the intuition is a type of knowledge that cannot be explained on the basis of reasoning or prior instructions. The intuition is undoubtedly play a role in a nursing practice, as they do in the conducting of research, and it is difficult to develop the policies and practices for nurses on the basis of intuition. So knowledge of something without being consciously aware of where the knowledge comes from. And next source of selecting the research problem, the exposure to the field situations. So during this field exposure, the researcher gets variety of experiences which may provide plenty of ideas to formulate research problems. So these are, during this field exposure, they get plenty of exposures. For example, while working in the field of researcher, observed a specific traditional practice for curing a disease condition. Now we are trying with the allopathic, Ayurvedic, and all type of interventions in a COVID pandemic situation, because the complete the medical fraternity is joined together for curing or providing a solution for COVID-19 pandemic. And solution with the experts, which is most important role it takes place. The getting the right information from the right person is most important. The experts are believed to be a sound experience of their respective field. So the consultation needs to be, it may be a surgical or medical or maybe a super specialty areas. The consultation related to that particular study to the right person is most important. The experts, or in addition to the experts, they may help in the field of current problem of discipline to be solved, which may serve as a basis for the formulation of research problem. And the second topic is formulation. In that formulation of and statement of the research objectives, which is most important. Once the statement of problem is ready, and next we need to give concentration and concern to the formulation of objectives. The formulation of objectives, which helps to identify the broad field or the subject area of interest to you, ask yourself, and what is it, and that really interests me as a professional. And the second one, it dissect the broad area into the sub areas, that is finance, stock market, previous metals, personal, financial, mutual, and fund, currency, etc. needs to be taken into consideration before the statement of objectives are made. And select what is the most interesting interest to your finance or stock market or previous metals or personal finance or mutual fund, currency, etc. Same like that. And what the nurse is very much interested about the area of whether she needs to do it in a neuro, cardio, or orthopedic, or gynecology, or education, or practice, nursing practice. So it needs to be like what exactly the most interesting area needs to be involved or incorporate in this needs to be clear. Fourth one is the raise the research question, what it is that I want to find out about this sub area. And the fourth one is the raise the research questions, make a list of whatever the questions comes to in your mind relating to your chosen sub area. And why does the market fluctuate? This is related to the other side of finance. And here there is any relation between the variables, between two variables that needs to be understood, and also analysis of various things needs to be, background work needs to be done on it, and also formulating the objectives to find, ascertain, to determine, or to examine from the main subjects. The sixth step is assess your objectives, which can achieve your objectives in time. And the examiner needs to ask about, do I have adequate amount of money, the finance, which is most important, like the budget, like is a self made self project, or the funded project needs to be confirmed, and that needs to be determined before the objectives are framed. And double check again, and make sure that I'm really enthusiastic about this study, and do I really have enough resources to undertake this study. And formulation of research studies objectives, the researchers needs to be reflect the questions chosen, the answers the investigator wants to study. The second one is whether the objectives should be can expressed either in a form of statement or question. As we, the style or the mode of the statement of problem can be, it may be a declarative form or it may be in a question form. So which will be serves as the steering wheel in the conduct of the research project. The characteristics of the research objectives. So it should be phrased clearly. There's a unambiguousness, and there should be a specificity should be there in the research objectives. And also the research objectives should be stated in a measurable terms, and should not be involved value judgments. So this researcher or the research objectives should be clear, concise, and declarative statement, and which provides a direction to investigate the variables. Generally, the research objectives focuses on the way to measure the variables, such as the identify or describe them. Sometimes the objectives are directed towards the identifying the relationship of difference between two variables. And also the research objectives is a concrete statement describing what research is trying to achieve. And also well-worded objectives will be by using a smart technique or smart mnemonic, that is M for S for specificity, M for measurable, A for attainable, and R for realistic, and the T for time bound. So this is the very important in formulating the research objectives. The researcher should consider about the smart technique or smart mnemonic. So these are the very important areas needs to be considered before the researcher prepares for the research objectives. And research objectives shall have a relevant, feasible, logical, observable, and unequivocable and measurable. Objectives is a purpose that can be reasonably achieved within the expected time frame and with the available resources. The need of research objectives are the researcher with a clearly defined objectives. The researchers can focus on the study. So these are the giving a base for the research to be conducted. The formulation of research objectives, which helps the researcher to avoid collection of data which are not strictly necessary for understanding and solving the problem that she or he defines. The types of research objectives, it is general objective and specific objectives. As I mentioned earlier, the general objectives are the broad goals to be achieved. The general objectives of the study state what the researcher expects to achieve by the study in general terms. And third one, the general objectives are usually less in number and specific objectives are more in number. It depends upon the research topic. The specific objectives are short term and it is a narrow focus. And general objectives can be broken into small logically connected parts to the to form the specific objectives, which is derived from the general specific objectives are derived from the general objectives. General objectives is met through the accomplishing all the specific objectives, and the specific objectives are more in number and they systematically address various aspects of problem as defined under the statement of problem. The key factors that is assumed to influence and causes the problem, and also this specific objectives, they should be specified and what the researcher will do in the study and where, and also what the purpose and all those things. And also coming to the hello. Yes, madam. I'll be, madam. 5 minutes. 5 minutes, madam. 5 minutes. Yes, madam. So here the general, one simple example given here, the general objectives and specific objectives. The effectiveness of planned teaching on the knowledge of staff nurses working in a psychiatric unit regarding the physical restraints for psychiatric patients in the selected hospital. And the general objectives made from that is to assess the knowledge of the staff nurses working in a psychiatric unit regarding their physical restraints. And the specific objectives are derived from the general objectives are: number one, to assess the knowledge regarding the physical restraints among the nurses working in the psychiatric unit. The second one is to evaluate the effect of planned teaching program on physical restraints among nurses, and also to associate the knowledge with the selected demographic variables. So these are the examples, and I'm just concluding here the research objectives. So the research objectives which helps the nurses to assess the prevalent, means this is another examples given here, to assess the prevalence of anemia among the adolescents, and also to formulate so like depends upon the topic, the researcher, what it may be anemia, or it may be a medical condition or surgical condition or super specialty condition, the area of interest. So there will be a once the statement of problem is derived, and we need to go for the general objectives and specific objectives, which is most important. So concluding with that, the identifying the right research problem or statement, which is most important for the research, because the complete research is based upon, it is a blueprint or it is the foundation or pillar of the research work. So the proper consideration and the proper importance, and the researcher should consider from the topic needs to be taken from the various resources what we have seen, personal experience and clinical experience and expertise, and all those in brainstorming, and all those things needs to be incorporated. The right topic needs to be selected, and based on that right topic and the objectives of general objectives and also the specific objectives needs to be formulated. So with that, I thank one and all, and especially for the organizers, and I just conclude myself. Thank you, madam. Thank you, sir. Over to you.
Thank you so much for this enlightening session, sir. This was very informative. And now the group is open for discussion. If anyone among the participants is having any question regarding the topic, he or she may raise his hand. And the icon may be seen in the below options on your screen, so that I can put that question to our respected sir.
Please, sir.
Sir, we will wait for few more minutes,
Sure,
so
sir.
that we will see if anybody is having any question.
Sure, sir. Sure, sir. If not, they can put it in a chat box.
Okay, sir. So since we have not received any question from related to this topic, so I will get back to Bushra ma'am. She will start the second session of this second presentation of the scientific session.
Thank you, sir.
Thank you, sir.
Thank you, sir. Thank you, Dr. Clement. Thank you, Mr. Shahid Siraj. Now, the second resource person, Professor Urmila Bharadwaj, Principal cum Professor, College of Nursing, Sharda University, New Delhi, India, on topic Writing Research Proposal to Generate Evidences. Ms. Nikhat Gauhar, Tutor Alamdar, College of Nursing and Medical Technology, will act as the chairperson. Ms. Nikhat Gauhar.
Sure, ma'am. Esteemed principal ma'am, respected dignitaries, organizing secretaries, faculty members, and my dear students. Assalamu alaikum and welcome to today's session of this 3 days webinar on nursing research methodology. Myself, Nikhat Gauhar, tutor, Alamdar Memorial College of Nursing and Medical Technology, IUST Avantipura. It is a great pleasure for me to introduce next resource person of this session, Professor Urmila Bharadwaj. Keeping in view her professional achievements and career highlights, she has made such an immense contribution in the field of nursing that it is difficult to define her in this short span of time. Ma'am has done her bachelor's in nursing at College of Nursing, AIIMS, New Delhi in 1983. She has done her master's in community health nursing at College of Nursing, Postgraduate Institute of Medical Sciences, Chandigarh in 1998. She has a professional experience of 38 years. Presently, she is working as Dean cum Principal, School of Nursing Sciences and Research, Sharda University. She has also worked as a Principal Professor, College of Nursing, School of Nursing Sciences, Jamia Hamdard. In addition to this, she is a member of Academic Council at Jamia Hamdard, member and chairperson of Board of Studies at Jamia Hamdard. She is also a chairperson, Faculty Committee, and Board of Research Studies at Jamia Hamdard, Professor College of Nursing. She has also been posted as an Assistant Director, Holy Family Hospital, New Delhi. She has also worked as Nursing Superintendent at Majidia Hospital, New Delhi. She has also participated in various curricular and co-curricular activities, like guiding BSc and MSc students for their research. She has been a member of various editorial boards and scientific committees. She has done 33 publications in indexed journals and presented papers in workshops and programs held in India and outside India. She has also been a member of Trained Nurses Association of India, Nursing Research Society of India, and Sigma Theta Tau Wisconsin University, USA. She has received various national and international awards like Shusharda Medical Sciences Award by Samaj Vikas Sansthan Meerut, Lifetime Achievement Award for Community Health Services, Best Academician in Nursing Education in Women Conclave, and she has been honored PhD degree on Commonwealth Vocational University, Kingdom of Togo. Dear participants, please join me in welcoming our speaker, Professor Urmila Bharadwaj, who is going to deliver speech on writing research proposal to generate the evidence. Welcome, ma'am, in this webinar.
A very good morning to all of you. And at the outset, I'm very thankful to Professor Dr. Talat, Vice Chancellor IUST, Professor Naseem Iqbal, Registrar IUST, Professor A.M. Shahid, Dean Academics, Professor Dr. Mahmooda Reddy, Principal, College of Nursing, and the Organizing Secretary and Associate Organizing Secretary. Thank you, Nikhat, for your kind words. This much long introduction was not required because we're already always behind the time. Anyway, I'm thankful to all of you, and it's my privilege to be at this juncture and share the stage with many eminent speakers of today, tomorrow. I'm also thankful to the participants who will give me a listening ear and listen to me. I'm sorry if I go too long. I'll try to make it very crisp and small because the time is already gone. Could you please share my slides? Or I can share the screen myself. Nikat, can I share the screen myself?
Okay, ma'am.
I can share. It's very important for anything we want to get. The money is very, very important. We are here to make a proposal to create an evidence because evidence is required to do a best practice. So evidence is required, so we are generating evidence by doing the research as well as for doing any research. You need to get money. Money is very, very important. And let me tell you, there are so many avenues today for nursing research to be conducted, and there are being conducted, being evidence, being practiced, whatever findings were there. Whatever findings are there. So it is very important. It's very important for all of us to create the evidence, and to create evidence, you need the money. So I request if you could share the screen. There is some technical glitch over here. If you could share the screen, I'd be very grateful. So the first thing is writing the research proposal. A research proposal describes what you will do, okay? What investigations are you going to do, why is it important, and how you will do such research. So this is important: what, why, and how. In any of the proposals which you are going to do, you have to actually do these things. Next slide, please. Next slide, please.
1 minute, ma'am.
So what, why, and how the research would be done, and that is what is going to be included in your proposal. Next is the definition of research proposal, which is a written statement of a future that an individual or an organization want to undertake. So it is a written document of your discipline. The characteristics of research proposal would be: the problems projected in proposal should have social significance and not just scientific value. So whatever we are doing, it should be utilized, it should be useful in the social arena. If it is just done for increasing the scientific value or any of those things, it is of no use. So it should have a social significance. The protocol need to be appropriate to the research question and should formally describe the whole process. The design of protocol should be feasible in terms of time, resource, and ethical consideration. These things have to be kept in mind when you are preparing a proposal, that it is feasible, you can do in terms of time, money, and you have the resources, and it is ethically That has to be kept in mind. The idea to be communicated should be relevant. The relevance is very, very important. Believable, interesting, and very honest. It must be clear, convincing, and persuasive. People should be convinced what you want to do is actually going to be utilized. It's useful. Only the logical and straightforward proposals can catch. Only the straightforward can catch people's attention. So only logical and straightforward proposals can catch attention of an agency. If you're planning to give this proposal for funding to any other agency or anybody who will approve this, you need to really have a logical and straightforward. The ones which fail to meet these criteria are going to be rightly rejected. Now, what is the purpose of this research proposals? First, the goal of the research proposal is to present and justify a research idea you have and to present the practical ways in which you think this research should be conducted. Research proposals contain extensive literature, reviews, and must provide persuasive evidence that there is a need for research study being proposed. I don't know, there is some problem. If you could show me the slides, it would be good. So, we have already gone with characteristics of research. Purpose of research proposal, I already said the research proposal contains extensive review literature, which is very important, and must provide persuasive evidence that are in need of the research study. In addition to providing the rationale for the proposed research, a proposal describes detailed methodology for conducting the research, consistent with the requirements of the professional or academic fields, and a statement on anticipated outcomes and or the benefits derived from the study. So purpose, we can in nutshell say that it should be relevant, interesting, original, and very important. It should be very, very important. Otherwise, whole exercise will be futile. In context, show that you are familiar with the field. You understand the current state of the research on that topic, and your ideas have a strong academic basis. That is why we do extensive review literature. The approach makes the case of your methodology, showing that you have carefully thought about the data, tools, and the procedure you will need to conduct the research. Confirm that the project is possible within the practical constraints of program, institution, which is funding. So there are some elements of this proposal. When we are preparing a proposal for funding or otherwise for any permissions, we really need to have some elements in our mind. The preliminary pages would be the title of your proposal, meaning thereby the statement process. Names, qualification, affiliation of the investigators, table of content, abstract, and summary. Then the body of proposal would be introduction about the topic, background of the study, rationale, why is it necessary, why you need to do this study problem, research questions, what questions will be answered by doing this exercise, aims and objectives, hypotheses, assumptions, delimitations, and operational definitions. Review of literature, as again and again I'm saying that review of literature will help you to get a deeper insight into the statement problem, and people will also, the funding agency or any other agency will understand that what is the extent of the problem and why you want to do it. Then they have research methodology. Your study approach should be clear, study design, the setting, subjects, who will be the subjects or the participants, method of assignment to the study group. If you're doing experimental group, who will you assign as a experiment and who will be your this thing. Control group. So control and experiment group, how will you assign and how will you decide who will do it? Instruments, what are you going to use, and the material, and your complete procedure of your data collection. How will you collect your data? So your methodology, you must consider the ethical. Is it ethical? Is it participant do not have any harm? So all those principle of beneficiaries, principle of no harm, all those things you have to keep in mind. The consent form has to be there, and it has to declare that it will be a privacy will be kept, or any other information you need to give to the participant. Statistical consideration. How do you plan to analyze the data? Based on your objective, how are you planning to do the data analysis? And how will you disseminate the results? When the pilot study will be done. So all those things you will write in your research methodology, and at the end you will write the references. The exhaustive references will be good one, because the agencies will see and find out that you have really have the good knowledge and background of your statement problem of your study. And at the end, you have to give the appendices. Suppose your tool, your methodology, your conceptual framework, information to the participant, the consent form, all these things will be there in your appendices, which you will attach to the proposal, and the permission letters, maybe from your own agency, your own university, or your institution, wherever you are working. Some important questions which will guide you, that is introduction. Who has an interest in the topic? You must see who is your funding agency. If you are funding, sending a proposal to ICMR, so what is the interest of them? Your study, will it interest the scientists? Will it interest the practitioners? Will it interest the policy makers, or any particular member of the society? So you must always keep in your mind, who am I addressing, who will be interested in my study? How much is already known about the problem? What is missing from the current knowledge? So that is why review literature, find out how much is known and what is missing. So you have to fill in that gap. What are new insights will your research contribute, and why is this research worth? Why it is worth? Why you need it? So, need for writing research proposals. The research proposal is a summary
Hello, ma'am, you are not audible. Ma'am, there is some network error. Hello?
Am I audible?
Yes, ma'am.
Urmila ma'am, you're not. Yes, ma'am. Now you're audible.
Yeah, there were some connectivity problems. Sorry for the technical glitches. There was a problem. Okay, am I audible now?
Ma'am, yes, ma'am.
Okay. So, can I have, just give me a minute. Okay. So, present your preparative material in a logical way. Help you to order your thoughts. When you talk to people, you brainstorm yourself, as it was said in the previous presentation, that you brainstorm. So then your thoughts will be much more clear and they will be in an orderly manner. Present your preparatory materials in a logical way. Highlight the way in which each section interrelates with others. Assist you in defining the boundaries of your study and concepts to be included. The more you sort out your ideas at this stage, the more effectively you will use your time. If you are sorted at the beginning, then we will not waste our time later on. So pre-proposal phase should be really sorted out, well thought, well discussed, and well prepared, so that you don't waste your time later. Not able. Can I share? Can I get the PPT, please? Okay. Then types of research proposals. There are new proposals. Some agencies, they put an advertisement. They ask in professional groups that this is a new proposal coming up. So if it is a new proposal, it has to be at the time you are sending it to the sponsoring agencies. Or maybe it is resubmitted at some point of time, it was not acceptable. So you can put it again. There are revised proposals. These are modified proposals that are pending, and otherwise they were not funded earlier. But again, you can revise this proposal, whatever they wanted, and resubmit it again. Supplementary proposals. A supplementary proposal are asked to support your proposal, which were already funded. They were funded, but then you have something supplementary. During the course of your data collection, you come to know that something more can be done. So you can have a supplementary proposals. And continuation proposal. Suppose you got a funding for 1 year, 2 years, but data collection or completion of the proposal is not there. So you can have ask for a continuation, maybe extension of the time or things like that. So it was originally being awarded by the agency, but the time frame was not enough. So maybe you can ask for a continuous, or agency itself had asked some more things to be done. So you can apply for a continuation of the proposal. Pre-proposal notice of an intent. Most of the agencies, they give up intent, notice for an intent that we are interested to get research done in this field. So that pre-proposal has to be prepared. You solicited your proposals. These are solicited proposals. These are those that are written and submitted in response to the issuance of a request for proposal. As I said, they will say in the intent, and request for proposal will come. A document that identifies a specific research problem of interest to the funding agency for which they are specifically seeking a solution. Interested investigator then submits a concept or a white paper, brief outlining the proposal, proposed solution to the problem. If the funding agency or company is interested, they may then request that the investigator submit a full proposal for the consideration. So if they ask, then you prepare it and they can consider and tell you to submit a full proposal. Unsolicited proposals are those proposals that are submitted by an investigator in response to a general call. That can be general call. For proposal that is issued by a funding agency or a company in a field or area of study. For example, if you go to the website of ICMR, you will find so many proposals are there. They are asking. So these are, if they are asking to the general call, you can respond to that and submit your proposals. Renewal or competing proposal are requests for continuing support for an existing proposal project that is about to be terminated and form the sponsor's viewpoint. Generally have same status as an unsolicited proposal. The title of research is very, very important. After identifying the research problem, a suitable title of the research should be given. The research title should be very specific, direct, concise, meaningful, and easily understandable. Not more than 1 or 2 lines, must accurately represent the objective and indicate the purpose of the study. Statement of the problem: when you are writing, the specific issues that need to be covered under the statement of a problem are mentioned as follows. Background information of the issue with the literature review, indication of an unexplored characteristics of the issue which you have taken. You have to highlight that what are the unexplored area in this particular problem, or knowledge gap, or a research question, and why one want to take that undertaking, why one want to do that study. That has to be said. And then we have to formulate the hypothesis. Hypothesis is a statement, or it is an assumption regarding the value of the relationship of the variables that need to be tested. So you have to test it. So frame a hypothesis which is to be tested during the course of study, and it provides a basis for investigation and ensure the proper direction in which the study should proceed. It helps one to arrive at appropriate conclusions, suggestions, and observations. Hypothesis should be clear, precise, and very, very specific. Objective of research is very, very important. Your statement and objectives are very, very important. What are you going to do? So the objective of research should be formulated clearly, simply, which can be understood easily. It must be formulated on the basis of the problem and the hypothesis, if any, indicating what specific problem to be investigated. The number of objectives depends on the nature of the research, but it should not be too many. Too many objectives are at times difficult to achieve. So it should be very short. Literature review. There are 5 C's of literature review: cite, compose, contrast, critique, and connect. Cite: keep the primary focus on literature pertaining to your research problem. Compare the various arguments. Many people have done the same studies. So you compare those and the methodologies they have used, the findings they have done. So compare, then contrast, argue, make the themes, and say how will it be different than mine? How people have got different findings, and then critique at the end. Take everything and critique and connect your research to that. So literature to your own area of research, the investigation which you are doing. How does your own work draw upon, or are they different from the previous one? Or you are going to synthesize something new. So you connect with that. That is important. Methodology is very, very important, because based on methodology also you will get your findings. So is it a qualitative or a quantitative, or you have mix? Will you collect this original data or work from primary or secondary source? Is your research design descriptive, correlation, or experiment? What is your population? What is your sample? How much? What is your sample size? How did you calculate the sample size? And when and where did you collect your data? Research method: what are you going to use in research data? The tools, the procedures, and why are these best method for research? You have to really think yourself, why this is best. If I'm using this particular tool, why it is best suited for my research. So that you have to do. And practicalities. Is it practical? The data which the tool which I have chosen, is it practical? Is it fine? Will this tool give me my outcome of the objectives which I have done? Can I foresee any of the potential obstacles if I use them? So this is how it is, and there is a little format. The format is not very exhaustive, but preliminary you must add these all things. The plant study will benefit who? Participant in terms of how. So participants always, when we take a study subject, we never think of their benefit. And there is one principle of beneficiaries in ethical consideration. So we must always keep in mind that our participants are going to benefit in which formal approval will be obtained from the institution ethical committee. A written permission will be taken from the head of the department or head of the institution, whatever the protocol is. All the participants will be informed about the study and purpose, and also about their participation, duration, and their involvement in the research. And by and large, what happens when we use the participant, when we never debrief them, what had happened to the research? So at the end, when we summarize, we must always try to debrief our participant. This is what I've come in the study. Because after collecting the data, we never go back to it. It is a good practice that we debrief about their findings to them. A written consent will be obtained from each participant involved in the study. It will be ensured that there will be no interference in the routine care of the treatment of the participant while collecting the data. If it is a patient, they are admitted, the routine care will not be hindered by your research. The anonymity and confidentiality of the participants will be maintained while collecting data and reporting the results of the study. The study participants will not be forced to participate in the study. It has to be their choice. They cannot be forced, even if they are under your care. So they should not be that I'm taking treatment from this, so I must. It should not be. No kind of a force should be there. It is just by their choice. Care should be taken not to cause any harm or discomfort to the client or study subjects. Improving implications and contributing to the knowledge. The research proposal which we are proposing, we should have implication and contribution to the knowledge. So improving the process in specific location or a field, informing policy objectives if we have, strengthening a theory or a model, we can have that research proposal, challenging popular or scientific assumptions. There have been so many studies we have been seeing from time immemorial. The study which was done previously, next time it is something else, next time it is something else. So every time, as the health science is very dynamic in nature, so is the nursing science, is very dynamic. So it keeps changing. So what was happening earlier, we need to really reassess, recheck, and see that something new is better or the first one was better. So, and creating a basis for further research. You have to at the end write the bibliography, which should be very exhaustive, written in a manner if anybody want to refer those. They should be referring them with ease. So your reference should be very clear, and the manner in which it is internationally accepted. It should be in that way references should be written. Plagiarism is a very important aspect. It is much talked about. It wasn't few decades ago, but plagiarism is coming in a big way, and it was seen by some of the research studies that in India we are creating a lot of literature, but when it was checked with the plagiarism, it was not a good thing that we were copying from others. So plagiarism is come in a big way, and there is a platform to check are just copying others. So that is very important. And before you submit your proposal, you check your plagiarism. Was this study done? This is a similar one. I am adding something. If you are adding, then it will not come. So you must yourself check first. Agency will anyway check it, but you must check for plagiarism. So research proposal should be written in one's word and not copied at all. Otherwise, it will come. The researcher before submitting should get proposal and get it checked by themselves. The proposal should preferably have similarity in that less than 10%. For our masters and other thesis, we say 20%, But when you submit a research proposal, more than 10% is not accepted. The schedule includes a detailed timeline of a project, explaining exactly what you will do at each stage and how long it will take. And popularly in community health nursing, we say it is a Gantt chart. It's nothing, but it is telling about how much time it will take for particular activity. So you have a schedule in front of you, research schedule, that you don't lag behind or you don't go fast. So Gantt chart needs to be prepared. This is an example of a Gantt chart where the objectives are written and the tentative dates are given. So background, when will you do research design, when it will be done, data collection and preparation, when the data analysis will be done, and when will you write and complete your testing, and when you will revise. So Gantt chart at the preliminary phase, when we had already thought about the research, we have already made the proposals, then we should always think about this objectives and your date. This is important. Budget, as I said, some people, the institution may sponsor, but many a times it is a costly affair. If it is a very big proposal, so you need to get money. So post exactly how much money do you need. I'll just show you the example of how to prepare a budget also. Justification. Why is this cost necessary to complete the research? The funding agency are very, very particular about getting the justification. Why this much? So you have to justify whatever cost you are doing. And source. They will ask, how did you calculate this much is money? Suppose I say that for data collection and preparing the material and tools and all, I will need this particular amount. They will say, how did you calculate? So I may say that it is from the previous experience from this, and that review literature will tell you that how they have calculated. The source is important. To determine your budget, you must think about what is the travel cost. Suppose your research is in a larger area. Do you have to travel? How often do you have to travel? How many people will go in the field and collect the data? So spending their time, maybe you need to send them in a remote areas and they need to stay over there. So all those things will be considered when you are talking about travel cost. Materials, what materials do you need? What technologies is required? So that has to be worked out. What kind of assistance? You need data collectors, you need research assistants, you need person to do the statistical analysis. All that has to be taken into consideration. The time you need to take a leave from your regular duties wherever you are working. So that cost also you must include. If you are taking your own time and you are not being paid from the original institution, you should take that also into consideration. This is a proposed budget. The items are here, budget in rupees, and if your proposal is for many years, 1, 2, 3, then you have to say first year what will be there, second year what will be there. So you divide it in a year wise. So there can be recurring cost, that is maybe salaries to the people, data collectors, surveyors, or whatever. Non-consumer items you would need, consumer items you will need. So there will be things like this. Many people very fondly they put total miscellaneous. And when they put miscellaneous, there is always a doubt in the funding agency. So miscellaneous, anything can come. Try to avoid that you don't write much of a miscellaneous. Even if you have written miscellaneous, you think something has been left out, then it shouldn't be a big amount. If you big a big amount in contingency and miscellaneous, the funding agency is always skeptical that why they do is a big. You name in particular and say very exhaustively this will be used. Miscellaneous, very less amount can be put in. So the revision, you have to do proofreading whenever you prepare a proposal. Do a proper proofreading of spelling, grammar, and accuracy. Many times, even a comma or a full stop can make a different sense to the sentence. So please check for spelling, grammar, and accuracy. It's better to involve a person for proofreading who's not involved with you, who has not written, because when we read again and again, we overlook our own mistakes. So get somebody from outside and ensure that it is very, very accurate. You have to attach some appendices. When you are preparing your proposal, some of the things you have to attach. That is interview protocols, if you have your tool, sample of informed consent form, cover letter sent to the appropriate stakeholders, official letter for permission to conduct the research, regarding original scales of questionnaires. If the instrument is copyrighted, then permission has to be taken. If you are taking any standardized tool, then you have to take permission. Can I use this? Writing to reproduce the instrument for the copyright holder or proof of purchase of instrument. Some instruments can be purchased also. So if you have purchased, then that proof has to be given. Now I'll just talk about some of the funding agencies which are available and in India and abroad. I don't claim that it is exhaustive, exclusive. There may be few more agencies coming up, and nowadays it is really a time. It's a right time to uncash and find out more fundings and getting funding. Many nursing personnel are getting a lot of funding from national and international agencies. So in Indian agency, UGC gives fund, Indian Council of Social Science Research, ICMR, Council of Scientific and Industrial Research, and Foreign British Academy, that is ACU, grants for international collaboration, Commonwealth Academic Fellowship, Academic Staff Scholarship, Ford Foundation. These are some, but there are so many coming, and we have, this is an era of information explosion. It is your capability, how much information can you get from anywhere. Though it is very less, and I think recently INC is also giving some proposals, some research funding to some of the proposals. So please keep abreast with the latest information. Keep seeing the sites of your professional bodies and see that where you can fit in. General foreign or international funding agencies are Earthwatch Institute, Ford Foundation, we said already, the Foundation for Future, Fulbright Commission. Fulbright Commission even sponsor the scholars in other countries to do the research. Harry Frank Foundation, Harry Ransom Humanities Research Center Research Fellowship, Horowitz Foundation for Social Policy, International Federation of University Women, Toyota Foundation, UCARI. UCARI is a UK-based foundation, and they are giving a lot of funding to the nursing research, the social and nursing research. The Social Science and Humanities Research Council. So these are the fundings, and in the nutshell, we can say that in nursing we do lot of work, lot of research is done. It is actually introduced in our UG level itself. So we have lot of capabilities. Our PG, UG, and PhD all have lot of capabilities, and we have much of a resource in us, but we have to tap. And when you get such kind of a funding, it adds to the research total thing which we have, as well as it adds into the knowledge and adds to your own profile as well. So get in collaboration. Collaborative research is very much talk of the town. So collaborate with similar kind of people we have, and various walks of life, various disciplines can come together and they can have this collaboration. And I wish all the best to the organizers and the convener and all for the successful completion of this webinar. And I think nothing could be better than this, because this is a time we have to do it. So thank you all very much. If anybody has any question, I'll be more than glad to answer.
Thank you, ma'am, for this wonderful speech. This session is open to the participants to ask the questions or clear their doubts. Anyone having a question? Anyone having any question can post their question.
I can see 4 questions in a chat box. I don't know, is it pertain to me? Okay.
Thank you so much, ma'am.
Thank you as much. Okay. Thank you so much.
Thank you, ma'am. We are grateful for the time and effort you took to share your knowledge and expertise, ma'am. Thank you. Thank you very much.
It's my pleasure. Thank you, sir.
Thank you, ma'am. Thank you so much. Now, time for a third resource person, Dr. Rita Dar, Community Health Officer, Center Health Education Bureau, New Delhi, India, will speak on ethics in nursing research. And Mr. Tabashir Bashir, Tutor, Alamdar Memorial College of Nursing and Medical Technology, will chair the event. Over to Mr. Tabashir Bashir.
Thank you, ma'am. Assalamu alaikum. Good morning, ladies and gentlemen. I welcome everyone. Thank you for joining us for first international webinar on nursing research methodology. My name is Tabashir Bashir, and I am the moderator of this scientific session. I am one of the teaching faculty of Alamdar Memorial College of Nursing and Medical Technology. Just a little housekeeping before we get started. If you have any question during the session, please type them into the question box in your Zoom app. Now, without further ado, we will turn the time to our next speaker. It is my pleasure to introduce our eminent speaker, Ms. Dr. Rita Dar, PhD from Center of Social Medicine and Community Health, School of Social Sciences at Jawaharlal Nehru University. She has done Masters in Community Health Nursing from Delhi University. At present, she is working as advisor to Kidney Warriors Foundation. Ma'am has key posting for more than 32 years in various government organizations. She worked on gazetted post for 1991 onwards and retired in the grade pay of Deputy Director. Ma'am has contributed in various articles for Child, the Elderly, Women, etc. in a quarterly health magazine published by CHEB. With her recent interest towards organ donation, as subject of her PhD thesis, she has published 17 papers in various national and international journals, exclusively on organ donation and transplantation, a unique and unexplored area in Indian scenario. Ma'am has a rich experience of more than 28 years in guiding the research work of medical graduates, nursing graduates, graduates of social science in various community settings in the DHE program under Delhi University. Ma'am has developed an innovative scientific game called Health Tombola, an organ and tissue donation and transplantation. It is a scientific, mathematical, entertaining, interactive, intensive-based health informative organ donation and transplantation among people and professionals. She has developed creative material for role play and social drama. Angdan is like Kanyadan is depicted in her 17th publication titled Semblance of Angdan with Kanyadan under Hindu marriage. Ma'am has a vast experience working in collaboration with various national and international organizations, WHO, ICMR, UNICEF, Times of India, etc. As a resource person and advisor to various national and international conclaves and conferences, several nursing and medical colleges facilitated her for her innovative health communication strategies. On International Women's Day, she was given an achievement award by HealthWire. With this, We are pleased to welcome our speaker, Dr. Rita Dar, for her speech on ethics in nursing research. Please welcome, ma'am. Dr. Rita Dar.
Okay, okay. Uh, am I visible?
Yes, ma'am, you are visible.
And am I audible also? Yes,
Yes,
I
ma'am.
think. Okay. See, you have told so much about me, what I did here in Delhi, and also thanks a lot for first of all giving me this opportunity, and I really congratulate you for organizing this workshop, this conference. Um, but to tell you the truth, I have the roots in J&K, and I'm really happy to address you people today after a gap of almost 35 years. So taught in I started my career in ancillary medical training school Jammu long back, uh, and I studied masters in nursing along with Dr. Mahmouda. I am thankful to her for giving me this opportunity. uh, uh, I uh, I will be talking to you about this ethical issues, what are the ethical problems, how we have to take ethical permissions in conducting research, and that is very much important. I think madam has already touched upon this topic, and I would like to share the screen with you and talk about this. uh, I would like to you to please share the screen with me. Host has disabled.
Ma'am, you can share your screen now.
I have no, but yeah, it is disabled by you.
Shahid sir, kindly share the screen for ma'am. Hello.
Yes, it is. It says host has disabled participant screen sharing. Please allow it.
Shahid sir, please allow ma'am to share her screen.
Ma'am, you can now share your screen, please.
Okay. Okay.
Yeah, ma'am, you can.
My topic is ethics in nursing research. I have worked in grade pay as deputy director in Ministry of Health and Family Welfare, and I have done masters, as you have already told. I have done masters in public health also from JNU and PhD from JNU. Now, ethics is a word. It's a Greek word which has come from ethos, meaning character. Like you should be ethical values are essential for any healthcare provider, including nursing. Like you have been you as students, sometimes your friends tell you something. Okay, I will tell you this thing, please don't share with others. So we always think that no, we should not be sharing. She has told me something confidential. Similarly, when we conduct research, whosoever tells us something, they divulge their truths, they divulge their confidential movements, they divulge their so many things which they do not want the others should come to know. So we have to maintain those ethics even in research, not only in day-to-day activities, not only but also in research. Whenever we conduct research, then ethical value or universal rules of conduct that provide practical basis for actions, intentions, and motives. Now, ethics in nursing research can be defined as the act of moral Values followed by a nurse researcher while conducting or assisting a research to ensure the rights and welfare of individuals, groups, community under study. And nursing research, as every other research, is guided, attuned, and illuminated by ethical principles like respect for the person's freedom and fundamental rights, protection of human health and life, and safeguarding the biophysical well-being and dignity of the subject. You have to respect the person's freedom. He may tell you something, he may not tell you something. So it is not that you will encroach into his personal freedom and say that, no, you have not told me this thing, you have not told me that, you tell me this also. There are certain things which I would not like to divulge you, but you have to respect that person's freedom. What all he has to, he will be telling you. Like when I conducted research, my research was, I had conducted research on organ donation from brain dead donors. It is something very, it's a new subject, and I was not allowed to do this research in where I proposed my synopsis. So my synopsis was approved by this JNU ethical committee, but the where I had to do this research, they did not permit me to do research. I should have fought with them. Why don't you allow me? Because you have already told me that you will allow me. You will not. But I did not do that. Sometimes people do not allow you to do the research because I was taking out ethical issues in organ donation and transplantation in armed forces organ retrieval and transplant centers. Brain death has so many ethical issues and nobody would like to divulge you, but that doesn't mean that if they are not allowing you, you have to do certain modifications in your thesis, you have to in your research proposal, or you can get approval from other places also. So it is not always wherever you say that you will be doing this research, you will be allowed to do the research. And I respected the institutional freedom. I respected their fundamental rights. I did not go along with, I did not fight with them. So I said, okay, you don't allow me, I will see that how I will do it. And then I did it in NATO in some other organization. So that means once, even after your synopsis gets approved, it is not always that you get ethical clearance from the place where you have to do the research. Although I was assured that I will be, I will be allowed to do this during my preliminary meetings with the organization. Then protection of human health and life. It is important that you protect the life of human beings as well as life, because you are not, you will not, although you are, if you do nursing research, if you do research of any kind, you are going to help the human beings. You are eventually going to help, but you should not be harming them. You should not be harming them. Like we have to conduct certain, we have to tell them there could be some risks. We have to see that whether they are willing to conduct this research, go ahead with the research. Then safeguarding the biopsychosocial well-being and dignity of the subject. We have to keep that he is a psychological being. You have, a person is a whole, we have to take a holistic view of a person. He's not a person who is physically present. He's a psychological being also. He's a social being. He has to interact with the people. He's a biologically living person. So you have to take all the nuances into consideration and conduct the research, and you have to maintain that dignity of the subject. Now, why is it important for the ethics, and why is it important for ethics in nursing research? Every research, whatever is, whether it is in nursing or some other research, it is important to consider ethics and give equal importance to the ethics, because it protects the vulnerable group and other study participants from effects of experimental interventions. And it safeguards the participants from exploitation, and it establishes the risk benefit ratio for the study. We have to see that how much risk is involved. Is risk more than the benefit, or if benefit is more, then only we could think about risk, but risk coverage has to be given there. Then ensure the fullest respect, dignity, privacy, and disclosure of information for fair treatment for study subjects. Whenever you are conducting research, you have to you have to disclose information about why you are doing this research. Like when I was taking information from donor families, they were asking me, why do you want to get so much information from us? I said, see, you may not be benefited. You may not be benefited because of my research, because you have already undergone those processes. You have undergone those stress situations. But if you divulge your stories to me, maybe this will help others to be benefited, because I will be talking to the higher authorities, I will be talking to the authorities and see that what all improvements can be made in brain death donations. So you have to respect the people, and you have to disclose information also, because you can't treat them that they are your subjects, you can do anything for them. You have to give them, you have to tell them each and everything to them. Building the capability of subjects to accept or reject participation in the study, and to have access to informed or written consent for conducting the research. Now, you sometimes even, I have told you, at one place I was rejected by the organization that they will not allow me to conduct this research, and I had to change the organization and conduct the study. Even the subjects will say that we do not want to divulge our truth to you. There were some people, when I talked to those people, the organ transplant coordinators, they were working in private hospitals, and there was some exploitation of the poor people. So they did not want to divulge those facts, because they felt if their hospital comes to know about that they have divulged some truths to me, it will be problematic, for she may lose the job. So for me, then in that case, what did I do? I said, okay, you don't I did informal discussions with them. I did group focus group discussions with them, and I conducted the research without naming the organization, without naming the persons. So there were people who rejected that they will not divulge the facts. They will even sometimes, when you give questionnaires, they say that we will not fill the questionnaire. So because they feel that because they will be signing the questionnaire, so they do not want that kind of information to be divulged to you. So you have to be strong. You don't have to be thinking that what next, how will we do the research. You can change the subjects, you can go to some other subject. See that there will be this kind of frustrations do come with the research project. So you have to accept those rejections and see that how you move ahead in your research. Now, there are three principles. First is principle of beneficence, principle of respect of human dignity, and principle of justice. These are three main principles important in nursing research. Now, what is principle of beneficence? It is must for a nursing research to establish that the risk benefit ratio. The risk could be physical, it could be social, it could be psychological. Like maybe they may be socially ostracized, they may be psychologically, they may be psychologically harassed by their peers. There could be some physical risks also. So you have to see that whether the risks are benefiting, whether the benefits are more as compared to risk. So risk benefit analysis has to be done. The benefit should be more and for the whole population rather than one or two individuals. The potential risk of the research study must be carefully found out to ensure the protection of participants from any harmful effects of the research. The risk involved in generating new knowledge by the research should never exceed the expected benefit of the people. Ensure protection from expected adverse psychological problems caused by the research studies. Now, for example, psychological or emotional distress. I have seen that when I was talking to the donor families, they had donated the organs of their young children. So there was emotional turmoil. They did not. There was some fear of unknown. They felt that why should be they talking to a stranger? So you have to make a very comfortable environment for them. They have to make them. You have to feel for them. You have to empathize with them. You have to give them a psychological reassurance that you are with them and you will not be exploited. And they said that they had sometimes these subjects, while relating their stories, they cried while relating those stories. So it was important for me to pacify them, because as a nursing professional, you can't ignore these things, seeing that only I have to conduct the research. You have to see that they are not in emotional turmoil, and if they are in emotional turmoil, you have to give psychological support to them, consolation. You have to do a lot of things for them so that they feel comfortable. To tell you the truth, there were some cases who said, ma'am, we will come to your home and we will talk to you and we will tell you what all happened to us. And there are very interesting stories in my research, and really I'm thankful to them, because once you give that kind of atmosphere to your subjects, and make them realize that you are with them, you support them. So they will come forward and give so many information to you, and there will be a lot of research inputs which are important for any kind of research you do. The research must be conducted by scientifically, scientific persons who should not cause discomfort or distress. As I have already told you, they should ensure physical, psychological, social, and religious comfort also. So you have to see that from which religion. I have seen that there were some people, they said we hum namaz padhne jayenge, baad mein aapse baat karenge. So that is also, you have to give religious comfort to the people, not that you are conducting research, these things are not important. So all these things are very important while you conduct study. It is not that you are conducting study, you are encroaching into the physical, psychological, and social boundaries of human beings, and you have to see that they do not feel distressed doing this. You have to see the timings also. I have seen that when patients were coming, these transplant recipients were coming to the hospital, so I had to interview them. They are not coming there for my interviews, they are coming there for getting treatment. So I was ensuring that they don't get distressed because I am there to get data. So I was seeing that when they are waiting for their appointment with the doctor, then only I conduct that interview and I give them comfortable position. That is very much important ethically, that you don't have to cause uncomfort, discomfort to them. You don't have to cause distress, because if suppose you keep on talking and he has an appointment with the doctor, how will he be interested in your talk? How will he interested in you, in divulging you the truth, what he was suffered and how it has affected him, and how these transplant recipients, they have managed their ways. So you have to give that kind of comfort, and you have to ensure that you are not encroaching into their timings also. And only whenever the time is available, they give you the time. And I'm sure that they do consider you, they do give a lot of information to you, only if you think about them also. Now, next is principle ethics emphasizes the freedom of choice. Participants have the right to accept or reject to be the participant in the research studies. They have full right to question you. They have clarification, doubts. They have the right to quit the study. Sometimes, they will give you half information, then in between they may leave. That they have the right to do that. So sometimes, even I had that problem. Like, I was talking to these recipients and I did not have much time to talk to them there in the hospital, because I did not want to take their time. But I had taken their mobile phones. So whenever writing those information, I rang them on WhatsApp talk. I have so many people who are on my WhatsApp nowadays. WhatsApp messages are there nowadays. You have a lot of even in Facebook friends you become. They talk. You can still collect so much information through WhatsApp, through Facebook, through SMS, through other social media. So there is no dearth of it. Only thing is that you have to create an environment, so that you create a friendly environment with them, and see that they will give you all the information, whatever is required by the students, whatever is required by your research. Sometimes they will say that we don't want to continue with the study. It's enough. We will only write 4 or 5 answers. So that means you don't have to, you don't have to go after them. No, you please, no, you have to do it for my research. You have to do it. So you have to do all those things. You have to take their opinions into consideration, and you don't have to take them for granted. Fully informed consent must be taken. Sometimes they are not willing to give written. You may be thinking that I have to take informed consent, like informed in the sense that you have to take the signatures. Sometimes they are reluctant to take signatures. Sometimes they are reluctant to, when you video record their interviews, they are reluctant. Why do they record maybe they misuse this information somewhere else. So they have their perceived threats. You cannot ignore those threats, what they have, and you have to treat accordingly. You have to treat them accordingly. The contents of the informed consent must include purpose of the research study, expected benefit, procedures, intervention involved in the study, expected time and nature of participants' involvement in the study, type of data, information to be obtained from respondents, details of the potential discomfort or risk for participants in the study, details of support available in case any harm occurs to the participants, mechanism to protect privacy and anonymity of participants, contact detail to collect information and clarification about doubts, which I have already told you. I did a lot of things. It really helped me. They are still my friends, and I am also coming to know after how many, I have one recipient. She had kidney transplant of a brain dead donor. A brain dead donor donated a kidney to her. She survived that kidney survived for only 7 years. Now she is again on dialysis. So if suppose I conducted my study till 2019 only. My research collected data till 2019, but I'm in touch with them. I also come to know what is happening now. Now she's again on dialysis. That means more the duration of research, the better the results are. So again, there is one more patient. She got liver from a brain dead donor. She is surviving even after 8 years. So these are giving me different perspectives. Yes, it is helpful. Although there are ethical issues, but at the same time, there are so many good things coming out of these brain dead donors. So we have to give correct information to the public. So that is what important for all these statement about voluntary participation of subjects and right to tell them about this thing. Now, next is principle of justice. This ethical principle directs the research abide by the participant to fair treatment and maintenance of privacy. See, if I am collecting data from one particular hospital, but they do not want these transplant coordinators, they do not want it to be named. So I said, Mrs. So-and-so from hospital A. I did not mention the name of the hospitals, or from one of the private hospitals, name name changed. You change the dates also. Suppose if I have collected information in 2016, I will write 2014 or date change. Yeah, year of the in the brackets I will write date has been changed, name has been changed, because you have to keep anonymity into consideration. You don't have, otherwise when your research goes in public, the people will say that why you have named me. So this is unethical. If you name an organization or if you name a person in your research findings. Individuals who decline to participate or withdraw from the study, you have to agree to they should be respected. The anonymity of the participants and confidentiality of the information must be maintained. No information collected from the study can be used for other study purposes. See, your people have divulged you their information. They do not want you to disclose it for some other research. So you have, if suppose your friends, oh please mujhe data de de, you have collected so much of data, you don't have to diverge that because confidentiality has to be maintained throughout the life. So right now I do not know when I have written the research PhD research. So I have already changed Rita, Pitta. I have given different names and I do not know their original names now. I always, because I have been writing this study thesis for a long time. So now the original names are not known to me. The fictional names are now known to me. No information collected from this can be used. Okay, the vulnerable subjects such as children, pregnant women, and physically disabled others, and who are conveniently easily as must be protected from undue or overuse of research purpose. Sometimes you say that children, okay, we know they are under our control, we are treating them, and they will be available to us all the time. So you don't have to take them for granted. They do have their time. They are human beings. They are not your servants to give you all the information and at whatever time you tell them to do it. Now, Indian Nursing Council has published the ethics of nursing in India in the 2006. That is to critically building professionalism, accountability in the profession. The code of ethics in nursing is as follows. The nurse respects the uniqueness of the individual and provides. The nurse respects the rights as partners. See, all these she has whatever they have whatever ethics of nurses, ethical code of nurses has been developed by Indian Nursing Council. They are applicable to research also. The nurse respects the uniqueness of the individual and provides individual without consideration of caste, creed, religion, culture, gender, socioeconomic, political status, personal attributes, or any other grounds. The nurse individualizes their care considering the belief of the individual and individuals. Then cultural sensitivities, develops and promotes a trustful relationship. The nurse respects the rights of individuals as partners in care, making them informed choices. She gives adequate and accurate information, allowing them to make informed choices. All these, are ethics for nursing. they are applicable to nursing research also. The nurse protects individual rights to privacy, maintains confidentially, shares information judiciously, respects the individual rights, thus competence to render quality nursing care. So whatever research we are doing, we want to provide quality nursing care. Eventually, whether it is information, education, and communication, whether it is giving care, whether it is prevention, treatment, everything, it has to be brought about. The nurse is obliged to practice within the framework of professionalism, legal boundaries, adheres to the code of ethics. The nurse is obliged to work harmoniously with members of its team members. The nurse commits to reciprocate the trust invested in the profession by society, demonstrates personal etiquette in dealing, demonstrates professional attributes in all the dealings. Thank you. Any questions now?
Over to Tabashir sir. There are some questions from the participants. Tabashir sir, please narrate those questions to our expert speaker. Perhaps Tabashir sir is not online. So, ma'am, I will like to ask you that question from a participant. The question is, when we are asking information from the research participants or research subjects through WhatsApp groups or Facebook groups, how do we maintain the confidentiality?
See, I think it should be one-to-one relationship. It should be. It should not be. It should be private message. It should not be something like you share with every team member of the. You can, even if you have that options, answer privately, ask privately. So you have to go about it. This communication has to be kept private. You have those options. You don't ask such questions which could create problems. It is not that if suppose you ask the name, so it's simple questions, but there are certain things which they would not like to divulge among in the social platforms. So you have to think about that. One-to-one relation should be there. It should not be in groups.
Thank you, ma'am.
Yes, thank you.
It was really a great session by correlating your personal experience with the topic, which really helped our audience to understand the particular subject. Now we will go ahead to take some questions from the audience. Please make sure to type your questions into the question box. Please, if any participant have any question, he can type it. It looks like that we have no more questions from the audience. I thank you once again, ma'am, for joining us today, and we will look forward to see you again next time, inshallah. I thank our audience. It was a pleasure to be with you today. Over to you, Bushra.
Thank you, Dr. Ritada. Thank you, Mr. Tabashir Bashir. With that concludes a remarkable session of this webinar. We'll be back tomorrow to add more innovative ideas to nourish our mind. Before leaving, I request every participant present this time to unlock their videos so that we can have a group photograph together. So it may take few seconds. So I request everyone whosoever is participant this time can share their videos, please. It may take few minutes because some people are doing.
पिट्टी मैम ऑफिस में 2 मास्क लगाए आपने.
Yes, we are done with taking our photographs. With this, we conclude today's session. We'll meet tomorrow, inshallah ta'ala, and may Allah ta'ala protect us from the ongoing pandemic. Thanks for being with us today. Thank you so very much. Over to Mr. Shahid, sir.
Thank you everyone for joining us. This was really an informative session. And tomorrow at 9 a.m. again we will be joining for the another scientific session which will be shared by 4 of our guest speakers. I hope inshallah that will be a stimulating session for all of us. Thank you so much.